If our members and guests would begin to take their seats, we want to get started. If our colleagues take their seats, and staff, and unless you're working your issue on the other side of the aisle, that's all right. Keep going. All right, I'll call to order the Energy and Commerce Committee and recognize myself for an opening statement. Today marks an important step in this committee's effort to combat the opioid crisis, which continues to wreak havoc on communities all across our nation. From our legislative and investigative hearings to the roundtable where we heard from families impacted by this deadly crisis, it is clear that Americans across the country are asking for more solutions from their elected leaders. Today, we will consider 26 pieces of legislation to combat the opioid crisis, and I hope these bills will receive bipartisan support just as they did at the subcommittee level 2 weeks ago. We know there's no silver bullet. We know there's no one-size-fits-all approach that will remedy the catastrophic effects of this crisis over the last decade. But much can be done to help vulnerable patients get the treatments they want and that they need, and to ensure those powerful drugs are not getting into the wrong hands. These bills will help protect our communities and bolster enforcement efforts, strengthen our prevention and public health efforts, and address coverage and payment issues in Medicare. These targeted solutions, as well as additional bills the full committee will consider next week, represent months of work that the committee has undertaken to listen to families, providers, patients, law enforcement, state and federal officials on how we can best assist them to take on this epidemic. Upon completion of our markups this week and next, we will have fulfilled our commitment to report a package of bills to combat the opioid crisis to the floor by Memorial Day. So I look forward to working with leadership to schedule floor action soon. Today, we will also be considering bipartisan FDA legislation to advance a timely reauthorization of the Animal Drug and Animal Generic Drug User Fee Act, which is authored by Mr. Mullen, as well as bipartisan legislation from Mr. Latta to modernize how we regulate over-the-counter drugs. Last, but certainly not least, we'll consider 5 important bills from our Energy Subcommittee today. In today's highly interconnected world, we're facing rapidly evolving and persistent cybersecurity threats. As the sector-specific agency for energy, the Department of Energy plays a critical role in making the nation's electric grid and oil and gas and natural gas infrastructure resilient to cyber attacks. But DOE needs Congress to provide them with new tools to get the job done. 4 of the bills before us today will do just that. They will help DOE strengthen cybersecurity preparedness, coordinate cyber incident response and recovery, and accelerate research and development on advanced cybersecurity tools and technologies. I'd say I'm really proud of the members of the committee on both sides of the aisle. You put in an incredible amount of work, both through the O&I investigative side of our House, as well as on the legislative side, to produce these bipartisan and really important pieces of legislation. With that, I yield back the balance of my time and recognize my friend from New Jersey, the ranking member, Mr. Pallone, for purposes of an opening statement.
Thank you, Mr. Chairman. Today, the committee will consider a large number of bills reported out of our Energy and Health subcommittees. The 4 cybersecurity bills before us will enhance the Department of Energy's efforts to strengthen the cybersecurity of our nation's electricity grid and pipeline network, and I support these 4 bipartisan bills and commend my colleagues who have taken leadership on the issue. While I commend Representative Green's effort to improve Representative Johnson's LNG licensing bill, I cannot support even an improved version. I believe an unrestricted export policy could significantly impact domestic natural gas prices and adversely affect American consumers and manufacturers. We will also consider 2 user fee agreements dealing with animal drugs and over-the-counter OTC drugs. Both have had extensive debate and deliberation aimed to give the FDA important resources and authority to ensure the safety and effectiveness of these products. In addition to these bills, today's markup mainly focuses on proposals to address the opioid epidemic. This complex public health crisis facing our nation requires thoughtful, measured solutions. As I noted during the subcommittee markup, I will evaluate the opioid bills in this committee based on 2 principles. One, whether the proposal meaningfully improves access to treatment for opioid use disorders, and 2, whether the proposal helps to prevent people from getting addicted to opioids in the first place. There are 25 small bills before us that make incremental changes around prevention and recovery. I support them all and commend the sponsors who have found ways to strengthen our laws within the drug supply chain and our public health system. I am concerned, however, that many of these proposals that most meaningfully improve or expand treatment for opioid use disorders will not be discussed today. For instance, I support the legislation that my colleague Ms. DeGette is working on to exempt a short supply of medication-assisted treatment from prior authorization requirements. I think this bill could have an immediate and meaningful impact on access to medication-assisted treatment, but that bill was not included in this process. I also asked the chairman to include a bill that I have introduced with Representative Richie Neal, the ranking member of the Ways and Means Committee, that would extend Medicare coverage to methadone clinics. Currently, seniors with opioid use disorders do not have access to treatment at methadone clinics, which has been a longstanding gap in the Medicare benefit. Failure to close this gap would be a missed opportunity and a serious shortcoming in any final legislative package. There were also a number of substantial bills during the subcommittee process that were left off the table that could have made an immediate impact. The most notable is Mr. Tonko's TREAT Act that would have an immediate effect on the number of providers treating opioid addiction. Also missing from today's markup is the Rural Docs Act, which would have increased the treatment capacity for substance use disorder treatment. And there's still significant uncertainty about what Medicaid and Medicare policies will eventually be marked up next week. So, Mr. Chairman, as we move forward, we need to be deliberative and thoughtful, and we need to address the evolving nature of the epidemic, which includes a shift away from prescription medications to extremely deadly opioid analogs like fentanyl. The shift exacerbates the need to expand access to life-saving evidence-based treatment, in addition to focusing on prevention. So I hope to continue work with my colleagues today on a list of opioid bills in addition to the others moving forward, Mr. Chairman.
Thank you. The gentleman yields back the balance of his time. Chair recognizes former chairman of the committee, Mr. Upton, for purposes of an opening statement.
Well, thank you, Mr. Chairman. Today's full committee markup is going to include several bills from both the Health and Energy subcommittees, and I'm pleased to see that the ACE Research Act, bipartisan bill that I've worked on with my colleague Debbie Dingell, is included as part of this markup. This bill gives other transaction authority to the NIH, allowing them to better partner with innovative companies doing cutting-edge research to address the opioid epidemic and get non-addictive pain medication to those in need. We also have 5 bipartisan energy bills that address cybersecurity, emergency preparedness, and energy security. We have to address the constant and ever-evolving threat of cyber attack. Every minute of every day, hackers are trying to penetrate our electric grid and pipeline systems. The DOE could do more to address these threats, but they need the authority to do so. So these bills, including H.R. 5175, the Pipeline and LNG Facility Cybersecurity Preparedness Act, will in fact allow us to be better prepared to confront these threats. Taken together, these bills are going to build a more reliable, resilient system. So I urge all my colleagues to vote yes. Thank you, Mr. Chairman.
And the gentleman yields back the balance of time. Other members seeking recognition. Mr. Green is recognized for 1 minute for purposes of an opening statement.
I want to thank the chair and ranking member for holding today's markup. There are several health bills that I wish to highlight and ask for everyone's support. I ask for the member support for the Comprehensive Opioid Recovery Centers Act, which I was proud to introduce with Representative Guthrie, Lujan, and Bouchon. This legislation will fund designated treatment centers where individuals will receive comprehensive patient-centered care for opioid addiction. I also ask for my colleagues to join in support of over-the-counter monograph safety Innovation and Reform Act and the amendment that will be considered. This bill will reform the currently inefficient and burdensome OTC drug monograph system that prevents the FDA from quickly updating the monographs to respond to safety concerns. This legislation has bipartisan support and the support of public health organizations like the March of Dimes and the Pew Charitable Trust. I also ask my colleagues to support H.R. 5554, the Animal Drug and Animal Generic Drug User Fee Amendments. This legislation reauthorizes ADUFA and AgDUFA. It's the product of intensive negotiations between FDA, stakeholders, and members on this committee, and which has strong bipartisan support. I thank the chairman. I yield back my time.
Thank the gentleman from Texas. He yields back. Chair recognizes the gentlelady from Tennessee, Ms. Blackburn, for 1 minute.
Thank you, Mr. Chairman. I appreciate the work that you and Dr. Burgess and the committee have done on the bills that are moving forward today, and also what we'll see next week. As I have worked in my district with law enforcement, those that are in treatment and recovery and with treatment facilities, one of the things they mention regularly is that they want to see partnerships between the federal and the state level, and they want to see research take place on the non-addictive painkillers, and to have these bills come before us that are going to meet some of these requests that will encourage that research into the non-opioid painkillers. And these are things that are timely. I appreciate the efforts, and I look forward to their passage. Yield back.
Thank the gentlelady. Chair recognizes the gentlelady from Colorado, Ms. DeGette, for 1 minute.
Thank you, Mr. Chairman. Thank you for this markup today. I'm supportive of all of the opioid bills, and obviously the monograph bill, which I'm the Democratic lead sponsor of. But I think that what we need to do in this committee, and I've talked to you, Mr. Chairman, and others, we need to make sure we're not nibbling around the edges of this opioid crisis. We need to make sure that we're addressing the crisis head-on, similarly to how we did with the AIDS crisis with Ryan White. Some of the issues we need to look at are research and development alternatives for pain treatment, how we're distributing opioids, physician education and prescription coordination so that we don't have overprescription, availability of MAT and other treatment programs for people, availability of health professionals to work with these folks, aid to the states so that they can combat this, and help with law enforcement as people shift away from legal opioids. These are just some of the things I thought up from the top of my head that we need to work on in a comprehensive way. And I'm hoping we can go on from today and do this in a bipartisan way. Otherwise, we're just really nibbling around the edges.
Gentlelady's time's expired. We look forward to working continuously with you on those issues as we move forward. Chair recognizes the gentleman from Ohio, Mr. Latta, for 1 minute.
Thank you, Mr. Chairman, and thank you very much for holding today's markup. I'm pleased that we're taking up several of my bills that would help modernize the Department of Energy to address cyber threats, promote federal coordination on opioid abuse reduction, and reform the over-the-counter monograph system toward a more flexible framework. H.R. 5239, the CyberSense Act, would direct the Secretary of Energy to establish a voluntary CyberSense program to test the cybersecurity of products and technologies intended for use in the bulk power system. Last month, during 2 Energy Subcommittee hearings, both the DOE Secretary and the FERC Commissioners expressed support for this policy as a way to help improve the grid's resiliency. H.R. 4284, the Info Act, would help to unravel and work to solve the opioid epidemic by allowing advocates and healthcare providers better access to information and data on the nationwide efforts to combat opioid abuse and more easily search for available funding. H.R. 5333, the Over-the-Counter Monograph Safety Innovation Reform Act, would affect products that Americans use every single day. This bipartisan bill would modernize an outdated regulatory system and allow for timely safety updates for 2 products and create a pathway for innovation in over-the-counter marketplace. I urge my colleagues' support of these 3 measures, and with that, Mr. Chairman, I yield back.
Gentleman's time's expired. Gentleman yields back. Chair recognizes gentlelady from Illinois, Ms. Schakowsky, for 1 minute.
Thank you, Mr. Chairman. I want to highlight one program that we know works for those with substance abuse disorder. It's called Medicaid. It provides coverage for 40% of those with opioid use disorder, but yet the Trump administration has waged war on this lifeline. The most recent Trump budget cut Medicaid by hundreds of billions of dollars. The Trump administration is encouraging work requirements for Medicaid enrollees, and a Price Waterhouse Cooper study found that 1.7 million people would lose coverage in the 10 states that are considering work requirements right now. Republican attempts to repeal the Affordable Care Act would have cut Medicaid by $800 billion. We should be talking about expanding Medicaid, not cutting it. Plain and simple, cutting Medicaid hurts people suffering from substance abuse disorder. Thank you, and I yield back.
Gentlelady yields back. Are there members on the Republican side seeking recognition? Chair recognizes the gentleman from Florida, Mr. Bilirakis, for 1 minute.
Thank you, Mr. Chairman. Appreciate it. There's no silver bullet solution to the opioid crisis. We must use a comprehensive approach, taking into consideration the health system we presently have, but also lay the groundwork for the health system of the future. I'm proud of the work this committee has done in relentlessly attacking this challenging issue. I'm glad we're marking up my bill today, co-led by my good friend Ben Ray Lujan. H.R. 5675 builds off the Comprehensive Addiction Recovery Act reforms and requires prescription drug plan sponsors under the Medicare program to establish drug management programs for at-risk beneficiaries. In addition, I'm pleased to see we're marking up measures aimed at strengthening security and resiliency of America's energy assets, both physically and digitally. I look forward to continuing, again, the great work of this committee and advancing these bipartisan solutions to the House floor. Thank you, Mr. Chairman.
Thank you, gentlemen. As time's expired, Chair recognizes the gentlelady from California, Ms. Matsui, for 1 minute.
Thank you, Mr. Chairman. Mr. Chairman, while I am pleased to work on a few targeted bipartisan bills that have been a part of this process to legislatively address the opioid epidemic, I'd like to point out that even if we passed all of these bills on the House floor, the sum benefit of all that effort would be completely overshadowed by the harm that would be caused if we made large-scale cuts to the Medicaid program. The President's budget, efforts to repeal the Affordable Care Act, and other proposals by Speaker Ryan have all called for billions of dollars in cuts to Medicaid. Medicaid is the primary payer of mental health treatment in this country, including substance use disorder treatment. Without it, we would take many steps backward in our efforts to address the opioid epidemic. I'm hopeful we can make policy changes here that would have a positive impact on people's lives. But I just want us to remember the big picture when we talk about the opioid epidemic. Thank you, and I yield back.
Gentlelady yields back. Any members on the Republican side seeking recognition for an opening statement? Any on the Democrat? Mr. Welch is recognized for 1 minute.
I thank you, Mr. Chairman, and look forward to passing these bills that will help. But two things. One, I've been having opioid roundtables all around Vermont, and it's inspiring on one level. So many people who are suffering from addiction are plunging into trying to help others. But second, we have to do two things. One, we have to preserve Medicaid. That's essentially the lifeline. We can't have these bills as a substitute. And second, we've got to invest in rural America. What I'm seeing as a common denominator is the economies of these small towns are collapsing. And unless we have rural broadband, as just one example, built out to our entire rural America, we're not going to give these folks the shot that hope brings to deal with this epidemic. I yield back.
Gentleman yields back. Other members on the Republican side seeking recognition? Seeing none. Chair recognizes the gentlelady from Florida, Ms. Castor, for 1 minute.
Well, thank you very much, Mr. Chairman, and thank you, colleagues, for coming together on these bipartisan bills today. But I think what is plain now is with the opioid public health epidemic, we need to be doing much more. We need to meet the scale of this crisis, and the AIDS epidemic of decades ago provides a model because Congress was criticized at that time for not acting fast enough or boldly enough, and finally got their act together with the Ryan White Act. And we need to be looking at something similar that's meaningful. Secondly, I think my Democratic colleagues are absolutely right. You cannot, on one hand, say, oh, we're addressing this public health crisis, and then on the other, say we're going to undermine Medicaid like the Trump administration and many on the other side of the aisle are doing. You simply cannot do that. If you listen to the testimony of experts here and folks at home, they need something dependable and consistent, whether it's funding, whether it's a more robust treatment, a comprehensive approach like Ms. DeGette mentioned, but those are the overriding issues, even as we move these bills forward today. Thank you. I yield back.
Gentlelady's time's expired. Yields back. Other members seeking recognition on the Republican side? See none. Others on the Democratic side? All Right. Dr. Reese, recognized for 1 minute.
Thank you, Mr. Chairman. I really do, as a physician and just a human being, really want to provide some comprehensive treatment and prevention for the opioid epidemic. And I really do sincerely say that this is a step forward. I really do want to express my thanks for even having these conversations and these bills. And I also really want to sincerely and genuinely raise caution, because if we do roll back Medicaid expansion, which 40% of patients rely on to get the treatment, if we eliminate mental health and emergency care as essential health benefits, then we're taking 1 step forward, 10 steps back, and we're actually hurting patients. Because the money you're putting in this bill to build health treatment facilities, yet you don't let your patients have the insurance or remove their insurance, then they won't be able to afford the services. So I just really raise caution for all of you to rethink the efforts in repealing the Medicaid and the essential health benefits. I yield back.
Gentleman yields back. Other members seeking recognition on the Republican side? Seeing none. Our final speaker this morning is the gentlelady from Michigan. Ms. Dingell is recognized for 1 minute.
Thank you, Mr. Chairman. The opioid epidemic is ravaging every corner of this country. And as many of you know, I've lived on all sides of it. My father was addicted to opioids at a time no one knew what it was, and my sister ultimately died of a drug overdose after years of hell and trying to get her help that we could not make work. I know the pain, the fear, the desperation, the frustration of living with family members with addiction, and the sadness when you don't win the battle. But I also live with a man who's in intense pain, who has to use opioids because there are no other alternatives. What we're talking about today here is not an academic exercise. It has real impact on people's lives across this country. Thank you, Mr. Chairman, for doing this markup, but we have to keep going. We must commit to keep working, to take a comprehensive approach. This means protecting safety net programs like Medicare, Medicaid, and CHIP, while also emphasizing the importance of getting people into treatment quickly and putting real money behind it. Lastly, we've got to work on we cannot forget that we've decimated the mental health system. People are taking these drugs because they're suffering from anxiety and depression.
Ladies,
Time's expired. Let's be committed to working together to really fix this.
And we are. Chair recognizes gentlelady from Washington, Ms. McMorris Rogers.
Thank you, Mr. Chairman. I want to thank the Health Subcommittee, Dr. Burgess, the full committee, Chairman Walden, for focusing this committee on combating America's opioid crisis. This committee has worked for years to prevent opioid abuse by investigating the causes of this epidemic and identifying legislative solutions. Chairman Walden has made stemming the tide of this scourge a top priority and has worked diligently and deliberately with members of both parties, both on and off the committee, to advance collaborative, bipartisan legislative solutions to counter the growing epidemic. This Republican Congress has led on this issue, most recently by providing the largest investment to date, nearly $4 billion, in the recently enacted omnibus to support treatment and prevention, improve law enforcement, and stop the flow of illegal drugs into our country. This committee has advanced a number of bipartisan initiatives that are now law to help address the opioid crisis. For instance, the 21st Century Cures Act provided $1 billion in funding to help states and territories combat addiction, and there's so much more. But I've run out of time, so I will yield.
Thank the gentlelady for her comments and a good reminder for American people. We recognize the gentleman from California, Mr. McNerney, for 1 minute.
Well, I thank the chairman and ranking members for the markup today. Congressman Bob Latta and I are co-sponsoring 2 bills that will enhance our grid security. As co-chairs of the Grid Innovation Caucus, we are focused on advocating for grid investment. H.R. 5239, the CyberSense Act of 2018, creates a program to identify cybersecure products for the bulk power grid through a testing and verification program. The bulk power system is the backbone of the American industry, and this bill will strengthen our system against cyber attacks. H.R. 5240, the Enhancing Grid Security Through Public-Private Partnership Act, creates a program to enhance the physical and cyber security of electric utilities through assessing security vulnerabilities, increase cybersecurity training, and data collection. These two bipartisan bills will help put us on a path to better securing our electric system. I ask the committee for the full support of this bill, and I yield back.
Thank the gentleman for his comments. Are there any other members seeking recognition? Seeing none. The chair now calls up H.R. 449, and in your list, that's probably number 10, as forwarded by the Subcommittee on Health on April 25th, 2018, and asks the clerk to report.
H.R. 449, to require the Surgeon General of the Public Health Service to submit to Congress a report on the effects on public health of the increased rate of the use of synthetic drugs.
Without objection, the first reading of this bill is dispensed with, and the bill will be open for amendment at any point. Are there bipartisan amendments to the bill?
Mr. Chair, I move to strike the last
For what purpose does the gentleman from New York seek recognition?
Move to strike the last word.
The gentleman is recognized to strike the last word.
I would like to recognize my fellow New Yorker, Mr. Jeffries, for his leadership in the Synthetic Drug Awareness Act. Synthetic drugs present an evolving threat, and we've already seen far too many young men and women die from synthetic drug addiction. In order to continue to combat this crisis, we need more information. To this end, H.R. 449 will require the Surgeon General to report to Congress the public health effects of increased use of synthetics by 12 to 18-year-olds. While Mr. Jeffries is not a member of this committee, I would like to read a statement on his behalf as follows. The opioid crisis is ravaging families across the nation with regard to zip code, income, race, religion, or gender. It is laying waste to young people in urban, rural, and suburban America. And just like we saw during the crack epidemic, it is putting a strain on community services and creating a generation of parentless children. In order to properly address these tough issues, Congress must learn from the mistakes of the past. We must act collaboratively, quickly, and creatively to attack the scourge of drug abuse from all sides. That is why I am so appreciative that this committee is advancing the Synthetic Drug Awareness Act to address teen drug use. With the information this study will provide, Congress can work to prevent substance abuse by younger Americans through an enhanced and enlightened lens. Mr. Chair, I yield back.
Gentleman yields back. Are there any bipartisan amendments to this bill? Are there any amendments to this bill? Are there any other members seeking recognition on this bill? Seeing none, the question now occurs on favorably reporting H.R. 449 as amended to the House. All those in favor will signify by saying aye. Aye. Those opposed, no. The ayes have it, and this bill is favorably reported. Chair calls up H.R. 4284. This would be number 11 on your list, as forwarded by the Subcommittee on Health on April 25th, 2018, and asks the clerk to report.
H.R. 4284, to establish a federal coordinator within the Department of Health and Human Services and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. Are there any bipartisan amendments to this bill?
Chairman.
For what purpose does the gentleman from Ohio seek recognition?
Thank you very much, Mr. Chairman. I have an amendment at the desk.
Clerk will report the amendment.
H.R. 4284, offered by Mr. Latta.
Without objection, the reading of the amendment is dispensed with. The gentleman is now recognized for up to 5 minutes to discuss his amendment.
Well, thank you very much, Mr. Chairman. My amendment to H.R. 4284 is forwarded by the Subcommittee on Health, accepts technical assistance by FDA in the following ways: extending the deadline to create a substance use disorder information dashboard from 60 days to 6 months, redrafting the dashboard provision to be an amendment to the Public Health Service Act, changing minimal wording on the formation of interagency substance use disorder coordinating committee, and altering how the committee reviews federal SUD grants and programs, from evaluating the effectiveness to providing recommendations for improving SUD grants and programs. And again, the Info Act is one of these pieces of legislation that came to me from being out in my district. We have a lot of small towns and communities out there that don't have grant writers, that don't have the ability to have people looking at things all day long. It gives them the ability to go online to find the help that they need and where the funds are. And with that, Mr. Chairman, I yield back.
Mr. Chairman, would you yield to me?
I yield.
I want to thank you for your leadership and work on this effort. As I've done multiple roundtables and meetings around my district, the themes you've identified and the effort to help get a simpler way to access federal programs is something I've heard time and time again. Didn't know it was out there, don't know how to reach it, don't know how to do this. And so thank you for your leadership on this. I know I'm not alone, and I would yield back.
Well, thank you, Mr. Chairman. I yield back.
Gentleman yields back. Other members seeking recognition? Seeing none, are there any bipartisan amendments or amendments on this bill? I guess we have the LADA amendment before us. So is there any objection? Those in favor of the LADA amendment will say aye. Those opposed, nay. The ayes appear to have it. The ayes have it. The amendment is adopted. Further discussion on the bill? Further amendments? Seeing none, if there's no further discussion, the vote occurs on final passage of the legislation as amended to the House floor. All those in favor will signify by saying aye. All opposed, no. The ayes appear to have it. The ayes have it, and the bill is favorably reported to the House floor. The chair now calls up H.R. 5002, number 12 on your program, and asks the clerk to report.
H.R. 5002, to expand the unique research initiatives authority of the National Institutes of Health.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any amendments? For what purpose, the gentleman from Michigan seek recognition, so recognize 5 minutes.
And I won't use the 5 minutes, that's for sure. We know that the opioid epidemic is a dangerous scourge that it affects millions of folks across the country, regardless of age, race, economic background. I would note that between 2000 and 2016, 600,000 folks have died from drug overdoses. According to the CDC, opioid overdoses claim, as we know, 115 people every day. In Michigan, there were over 1,700 opioid deaths last year alone. That's up from only 455 total drug-related deaths in 1999. So using better science to understand the biology of pain and addiction is the first step in combating this devastating crisis. With the help of our colleagues in Congress, we do have an opportunity to collaborate with some of the best minds in the world, but we have to tap those tools and resources to overcome the challenge. That's why Debbie Dingell and I have introduced bipartisan legislation, H.R. 5002, this bill, Advancing Cutting Edge Research Act, ACE. This bill provides the NIH with new flexible authorities to conduct innovative research on ways to prevent, treat, and cure diseases, including vital research to respond to public health threats such as the opioid epidemic. This forward-looking bipartisan legislation will spur urgently needed research on new non-addictive pain medications, much along the same lines as what we did with 21st century cures. 25 million Americans suffer from pain every day, and it's essential that non-addictive medications are available to them. We can innovate our way out of this crisis, but we have to face the challenges that stand in the way. That's what this bill does. I would urge all my colleagues to support it and yield back my time.
Gentleman yields back the balance of time. Chair recognizes co-sponsor of the bill, gentlelady from Michigan, my friend Ms. Dingell, for 5 minutes.
I move to strike the last word.
So recognized.
Thank you, Chairman Walden and Ranking Member Pallone. Thank you for advancing this legislation. As I've said in my opening statement, I've lived on all sides of this issue. I live with a man who is in chronic pain, and the only hope for him right now is opioids to live life comfortably. The doctor says he's not addicted because he needs it, but he becomes afraid that he will be addicted. We got to be careful to not let the pendulum swing too far in either direction, and we cannot deny medication to those who need it. As Fred said, my colleague, Mr. Upton, 25 million Americans suffer from pain every single day. And while pain may not be the fifth vital sign, it's a major issue that needs to be addressed in modern medicine. We cannot stigmatize people who legitimately suffer from chronic pain. It's only going to make the opioid epidemic worse. One thing we can all agree on is that we need more alternatives for opioids in this country. This way, we can give people the relief they need from crippling pain while not subjecting them to the risk of addiction. It's going to require a lot of work and a lot of research to accomplish it, which is why it is so essential that we start this work now. The ACE Research Act accomplishes this goal by spurring innovative research into non-opioid pain medications at NIH, which will ultimately lead to the next big breakthrough, which will benefit patients. This bill gives the NIH director what is known as the Other Transaction Authority, so that the NIH will be able to move more easily to partner with innovative companies who are working with cutting-edge technology to address the opioid crisis and other public health interests. In congressional testimony earlier this year, NIH Director Dr. Collins said that giving this agency the authority would improve their ability to do the research we need desperately into non-opioid pain alternatives. Well, we listened to that suggestion, and we're delivering that in this bill. There are so many people focused on the opioid epidemic these days, but many small startup companies are hesitant to partner with the federal government on research because the terms of a grant or a contract are just too rigid and no other options are available. The ACE Research Act will ensure that NIH is able to partner with real innovators on research. You never know where that next breakthrough might be coming from, and this bill ensures that we will leave no stones uncovered. By funding research on new treatments quicker, we're ensuring that we're going to reach patients faster. And a future with more effective non-opioid pain medications is a future with fewer opportunities for addiction. That's something we all agree on. I'm pleased that the legislation has the support of the American Medical Association, the American Academy of Neurology, and the Coalition to Stop Opioid Overdose, among many others. I want to thank my friend and my colleague, Congressman Fred Upton, for working on this legislation with me and getting it to where we are. This is the first step towards ensuring we are doing the best research in this country on alternatives to opioids for pain medication. I urge my colleagues to join me in supporting H.R. 5002, and I yield back the balance of my time.
Thank the gentlelady. Are there other members seeking recognition on this topic? Yes, gentleman from California is recognized for purposes of striking the last word.
Well, I was going to ask to strike the last word.
You're recognized.
I appreciate
5
the
minutes.
majority's empathy on this for the pain that people suffer for addiction and their willingness to work across the aisle. I just wish they would extend that pain to the people that suffer from violence of gun deaths and work with us to conduct research on the causes of gun violence and ways to stop it. With that, I yield back.
Gentleman yields back. Are there other members seeking recognition on H.R. 5002? Seeing none, the question now occurs on favorably reporting H.R. 5002 to the House. All those in favor shall signify by saying aye. Aye. Those opposed, no. The ayes have it. The bill is favorably reported. Chair now calls up H.R. 5102. This is number 14 on the list, and asks the clerk to report.
H.R. 5102, to amend the Public Health Service Act to authorize a loan repayment program for substance use disorder treatment employees and for other purposes.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? Mr. Guthrie is recognized. Did you want to speak on the bill? Nope. Okay. Are there any members wishing to speak on this bill? If not, then the question now occurs on favorably reporting H.R. 5102 to the House. All those in favor will signify by saying aye. Aye. Those opposed, no. The ayes have it. The bill is favorably reported. The chair now calls up H.R. 5009, that's number 13, and asks the clerk to report.
H.R. 5009, to include information concerning a patient's opioid addiction in certain medical records.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there bipartisan amendments to this bill? For what purpose, gentlemen from West Virginia seek recognition?
For a bipartisan amendment.
Clerk will report the McKinley amendment.
Amendment to H.R. 5009, offered by Mr. McKinley.
Without objection, the reading of the amendment is dispensed with. The gentleman is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. Last month, our committee held a roundtable discussion with families whose loved ones were lost due to the scourge of the opioid epidemic. And during that discussion, we heard a moving story, particularly moving story, from a woman named Amy, whose son, Emmett, had passed away from an overdose. She shared that her family was surprised to learn that her son had overdosed on multiple previous times, but they were never notified due to a misinterpretation of the HIPAA law by hospital staff. Amy shared that had they only known, they might have been able to intervene and prevent that final overdose that claimed Emmett's life. That story is why I'm offering this amendment to the Jesse's Law legislation. This amendment simply requires the Secretary of Health and Human Services to annually develop and disseminate materials to healthcare providers with a clear explanation of the permitted disclosures under HIPAA and other federal privacy laws in emergency situations, including an overdose. The bill does not make any further changes to HIPAA. I'm grateful to have the support of the sponsors of this bill with Mr. Wahlberg and Ms. Dingell, and urge the adoption of this bipartisan amendment. I yield back.
Gentleman yields back. Are there other members seeking recognition? For what purposes does the gentleman from Michigan seek recognition?
Thank you, Mr. Chairman, for slowing down the pace there.
Yeah. For what purpose do you seek recognition? To speak on the amendment. The gentleman's recognized for 5 minutes on this amendment.
Before I discuss the amendment, I'd first like to speak generally on H.R. 5041, the Safe Disposal of Unused Medication Act, bipartisan legislation that I introduced with my good friend and colleague, Jesse's Law. I rise to speak in support of H.R. 5009, Jesse's Law, a bipartisan bill that I introduced with Congresswoman Debbie Dingell. The bill is named in memory of Michigan resident Jesse Grubb, who tragically died of an opioid overdose in 2016. Jesse had battled a heroin addiction for nearly 7 years, but had been clean for 6 months. She had made a new life for herself in Michigan and was training for a marathon when an infection related to running injury required her to have surgery. Jesse's parents informed the hospital that she was a recovering addict. However, despite informing the hospital of her history with addiction, the information never made it to her discharging physician. As a result, Jesse was unknowingly discharged from the hospital with a prescription for oxycodone, which ultimately led to her death the following day. If Jesse's past history of addiction had been noted on her chart in a manner similar to other potentially lethal medical concerns, like a drug allergy, Jesse might still be here today. Jesse's tragic story was entirely preventable and is an example of why we need common sense legislation like Jesse's Law. Jesse's Law will require the Department of Health and Human Services to establish best practices for hospitals and physicians for sharing information about a patient's past opioid addiction when that information is willingly shared by the patient with their doctor. By ensuring medical professionals are equipped with the right processes and tools to treat their patients, we can prevent future overdose tragedies like Jesse's and ultimately save lives. I urge adoption. I strongly support Representative McKinley's amendment, and I thank my friend from West Virginia for working with me and Representative Dingell in offering this bipartisan amendment. The amendment will strengthen the underlying bill by ensuring emergency room physicians receive yearly guidance on how to appropriately notify a patient's family members after there has been an overdose. Family members play a pivotal role in helping their loved ones get the treatment they need. However, if family is never notified after their loved one experiences a potentially fatal overdose because of a misunderstanding of federal HIPAA privacy rules, then they may never have the opportunity to help their loved ones before it's too late. This is a common sense amendment, and I urge its adoption to the underlying bill. I thank the chairman. I yield back.
Gentleman yields back the balance of his time. Other members seeking recognition. Chair recognizes gentlelady from Michigan, Ms. Dingell, for 5 minutes.
Thank you, Mr. Chairman. I move to strike the last word. Thank you. I support this amendment, and I thank my colleague from Michigan for working with all of us on this. I have to say this. I don't think you can know what it's like to be a family member that's trying to help somebody, that doesn't know where they are, where they're looking for them, the desperateness, and HIPAA making it impossible for you to get information you need. This amendment is needed. This bill is needed. Jesse was this family, Tim and I have gotten to know this family. Their daughter, they were open. The doctor knew she had been an addict. They gave her 50 pills when she was discharged, and she was dead the next day. This death was preventable. We need to make sure medical providers have the information we need. I urge my colleagues to support this bill.
Gentlelady.
And I yield back.
Gentlelady yields back the balance of her time. Are there other members seeking recognition? Seeing none, the committee will now vote on the amendment from Mr. McKinley. Those in favor of adopting the amendment will vote aye. Aye. Those opposed, nay. The ayes appear to have it. The ayes have it, and the amendment is adopted. Are there other amendments to this legislation? Seeing none, anyone else seeking to strike the last word? Seeing none, the question now occurs on favorably reporting H.R. 5009 as amended to the House. All those in favor shall signify by saying aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the bill is favorably reported as amended. The chair now calls up H.R. 5176. This would be number 15 on your list, as forwarded by the Subcommittee on Health on April 25, 2018, and asks the clerk to report.
H.R. 5176, to require the Secretary of Health and Human Services to provide coordinated care to patients who have experienced a non-fatal overdose after emergency room discharge and for other purposes.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments?
Strike last.
For what purpose does the gentleman from West Virginia seek recognition?
Strike the word.
The gentleman's recognized for 5 minutes.
Mr. Chairman, when patients come into the emergency rooms with a substance use disorder, hospitals offer treatment or referrals to other providers, but the demand for these services far exceed availability. Treatment is particularly scarce in rural communities, despite having an average overdose death rate that is 45% higher than metropolitan areas. In March, the Center for Disease Control reported that emergency room visits for opioid overdoses had risen 30% since July of 2016. This is why I joined with Congressman Doyle to introduce this bipartisan Preventing Overdoses While in the Emergency Room Act, also known as the POWER Act. This legislation will provide competitive grants to emergency rooms, especially those in high overdose areas and in rural areas, to establish procedures for providing medication-assisted treatment in the ER and engage in what might be known as a warm handoff of patients to qualified treatment providers, to hire coaches, counselors, and social workers and other professionals to treat the patient's substance abuse disorder there, beginning in the emergency room, and establish an integrated care model for implementation in other emergency rooms across America. This bill would ensure that overdose patients receive the treatment they need in the emergency room and giving them a better shot at recovery. This legislation is supported by the Addiction Policy Forum, the National Council of Alcoholism and Drug Dependence, the National Rural Health Association, and the American College of American Physicians. I urge my colleagues to support this legislation and ask unanimous consent to enter letters of support in the record.
Without objection, does the gentleman yield back? The gentleman yields back the balance of his time. Chair recognizes the gentleman from California.
Mr. Chairman.
Okay. Did you have an amendment?
No, I'm a co-sponsor of the bill.
Okay. Yeah. Chair recognized. I'm sorry. I didn't do. Chair recognized the gentleman from Pennsylvania for what purpose?
Thank you, Mr. Chairman.
Strike the last word. So recognized 5 minutes.
I move to strike the last word in support of H.R. 5176, the Preventing Overdoses While in Emergency Rooms Act.
First responders and emergency departments are doing a great job of administering naloxone and saving lives of a lot of people who suffer from an overdose. But we're missing a critical piece of the puzzle. Those people are often not being connected in time or in a meaningful way to evidence-based treatment. In fact, nationally, only 1 in 5 individuals who need treatment for opioid addiction received treatment in the past year. This means that those same patients are ending up in the ER again for the same problem or worse. Researchers have found that starting medication-assisted treatment in the hospital followed by a referral for ongoing treatment results in more effective and less costly treatment for the patients. This bill will help hospitals do just that. The bill will provide grants for hospitals to begin administering medication-assisted treatment and coordinating continuing care after a patient is seen and discharged from the ER. By starting treatment right away in the emergency room and then handing those patients right off to longer-term substance abuse treatment providers, what we call a warm handoff, we can dramatically increase the likelihood that they will quit using and have a successful recovery. This bill gives patients a much greater chance of finding and completing treatment and ultimately getting their lives back. I want to thank my friend and colleague, Mr. McKinley, and his staff for their hard work on this bill, as well as the support of the American College of Emergency Physicians and the Addiction Policy Forum. Mr. Chairman, without objection, I would also like to submit a letter of support from the American Hospital Association for the record.
Without objection.
I look forward to continuing to work together on this important effort. Mr. Chairman, I thank you, and I yield back the balance of my time.
Thank the gentleman, and he yields back the balance of his time. Just for our members, we're having a little difficulty with the clock, and so I am keeping a timer here on my alternative clock device, shall we say. Other members seeking recognition. I recognize the gentleman from California for purposes of offering an amendment, I understand.
Yes, Mr. Chairman. First, I want to applaud Representative.
We'll have the clerk report the amendment.
Amendment to H.R. 5176, offered by Mr. Ruiz.
Without objection, further reading the amendment dispensed with. The chair now recognizes Mr. Ruiz.
Thank you. I want to applaud Representative McKinley and Representative Doyle. This is music to my ears as an emergency physician, and I know these kind of projects work. I have oftentimes wished I had these type of resources when I took care of patients in a busy emergency department. I have an amendment at the desk that I am actually going to withdraw, but I believe I want to add to the conversation on this bill and this problem that I'm going to address. The grants created by this bill will fill in a gap in current coverage by ensuring that patients presenting to the emergency department can get on the path toward recovery seamlessly and easily. I've seen countless patients in the emergency department who I was unable to help enter long-term treatment due to lack of funding. But it isn't just funding that can be the problem. There are well-intentioned regulatory barriers that prevent physicians from doing their jobs and getting patients the treatment they need for opioid and substance misuse disorders. My amendment is simple and will eliminate one of these barriers. It will remove a rule that restricts doctors from giving a patient more than 1 day's worth of buprenorphine or other medication-assisted treatment at a time. Instead, they will be allowed to provide 3 days' worth at once. Currently, if a patient goes to see a doctor and needs longer-term care, the physician can administer only 1 day's worth of the medication for 3 consecutive days while securing long-term treatment. But that means, if you think about it, for those 3 days, the patient has to make a separate visit to the doctor or emergency department, no matter how far they have to travel, no matter how long they have to wait in a busy and crowded emergency room, every 24 hours, which, as we all know, rarely occurs. This is the same 3 days of treatment currently authorized under DEA regulation. If a patient comes into the emergency room on a Tuesday morning, this may not be a problem since the long-term treatment facility and providers may be ready on Wednesday to see the patient. But the opioid epidemic is not a Monday to Friday, 9 to 5 kind of problem. It strikes at night or on the weekend, and providing some flexibility to physicians can help get more patients into treatment. This will save time for patients. It will increase the chances that a patient will remain on medication-assisted treatment and off of illegal and illicit drugs while they are waiting for long-term treatment. It will save money for the healthcare system by requiring fewer visits, and it will maintain all of the other safeguards currently in place under DEA regulation. Most importantly, it will save lives. Let me say that again. It will save lives. We know that no one measure will fix the opioid epidemic, but this underlying bill and this amendment are a step in the right direction. So I will introduce this amendment as a bill and hope to work with Republicans and Democrats to help improve and save
Dr. Ruiz, if you would yield to me.
Sure.
I get where you're coming from. I think you make a lot of sense on this, and we want to work with you perhaps in getting this included in something on the way to the floor.
Perfect.
Representing a district that's bigger than any state east of the Mississippi, it makes no sense to me that my constituents would have to drive back to the doctor, which could be an hours-long drive on day 2 of detoxing, and then day 3 of detoxing till they can get in somewhere.
Yeah.
So we're interested in working with you on this.
Thank you very much. I look forward to that.
And do you withdraw your amendment at this time?
I do withdraw my amendment.
Gentleman withdraws his amendment. Chair recognizes the gentleman from Pennsylvania, Mr.
Move
Doyle.
to strike the last
Strike
word.
the last word.
I just want to speak briefly in support of Dr. Ruiz's amendment. While I was working on this bill with Mr. McKinley, I was contacted by the governor of Pennsylvania, as well as doctors on the ground, that this change could really be helpful for patients to bridge the gap between the ER and long-term treatment. So, Mr. Chairman, I look forward to continuing to work with the committee staff to try to incorporate this amendment into the underlying bill. And without objection, I'd like to submit a letter of support from Governor Wolf of Pennsylvania for the underlying bill and the amendment for the record.
Yeah, without objection, we look forward to working with you on this.
Thank you. I yield back.
Gentleman yields back. Are there other members seeking recognition on this legislation? If not, question now arises on favorably reporting H.R. 5176 as amended to the House. All those in favor will signify by saying aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and this bill is favorably reported to the House. The chair now calls up H.R. 5197. This would be number 16 on your program, as forwarded by the Subcommittee on Health on April 25, 2018, and ask the clerk to report.
H.R. 5197, to direct the Secretary of Health and Human Services to conduct a demonstration program to test alternative pain management protocols to limit the use of opioids in emergency departments.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to this bill? Chair recognizes the gentleman from West Virginia for purposes of striking the last word for 5 minutes.
Thank you, Mr. Chairman. Mr. Chairman, developing alternatives to opioids for pain treatment is an issue our office has been working on for years. We've successfully increased funding for the National Institute of Health to achieve this objective, but we must do more to find alternatives in the emergency room, where many patients first come into contact with opioids. Emergency rooms in several states have been developing new and innovative programs to reduce their overprescription of opioids. One emergency room in particular, St. Joseph's Medical Center in Paterson, New Jersey, has reduced opioid prescriptions by 82% in the last 2 years. They've achieved this by targeting non-opioid therapies instead of relying on opioid painkillers, as has been the normal procedure over the past 10 years. This bipartisan legislation that we're co-sponsoring with Congressman Pasquarello from New Jersey would establish a demonstration project and provide grant funding to test alternative pain management protocols. At the completion of the demonstration period, the Secretary of HHS would report to Congress the results along with recommendations for broader implementation. The legislation is supported by the American College of Emergency Physicians, America's Essential Hospitals, the American Hospital Association, and the American Psychological Association. Mr. Chairman, I urge my colleagues to support this bipartisan legislation.
Will the gentleman yield?
And yield back my
No,
time.
will the gentleman yield?
Yeah, I'll yield back. Oh, no, yes, I'll yield.
Thank you very much. Mr. Chairman, I want to thank the gentleman for yielding, and I want to thank him for his tireless work on this bill, along with our colleagues Pascrell and Tipton, who are also original co-sponsors of the bill. As the gentleman from West Virginia said, the bill addresses an important part of this committee's response to the opioid epidemic, which is prevention. The ALTO bill would help hospital emergency rooms test alternative pain management protocols because the emergency rooms are especially susceptible to drug diversion behaviors due to time and resource combinations. This combination of factors increases the risk for opioid disorders among emergency room patients. And so what this bill does is it helps limit opioid prescriptions in the emergency room, which creates fewer opportunities for drug diversion. In Colorado, we have one of these pilot projects like they do in New Jersey, and it's at Swedish Medical Center, which is in my congressional district. They tested alternative pain management protocols in 10 hospitals across the state of Colorado, and in the first 6 months, opioid prescriptions dropped by an average of 36% at these participating hospitals. And so this is a program that can work, and I think it really can help us in our effort to have an overall prevention response to the opioid epidemic. With that, I'll yield back to the gentleman from West Virginia.
Gentleman yields back. Other members, are there amendments to the bill? The gentleman from New Jersey has an amendment at the bill at the desk.
Yes, Mr. Chairman.
Clerk will read the title of the amendment.
Amendment to H.R. 5197, offered by Mr. Pallone.
The amendment will be considered as read. The staff will distribute the amendment, and the gentleman is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. My amendment is labeled amendment in the nature of a substitute. It makes a small technical change to the underlying legislation. It would create a demonstration program to support emergency departments in developing, implementing, enhancing, or studying alternative pain management protocols and treatments that limit the use and prescription of opioids in emergency departments, supporting the development of additional protocols for alternatives to opioid medications as proposed by this bill can help reduce the number of those put at risk of addiction and lead to fewer fatal and non-fatal overdoses. And I encourage my colleagues to support the amendment as well as the underlying legislation. I yield back.
Gentleman yields back. Other members wishing to speak on the amendment? Seeing none, the vote occurs on the amendment offered by the gentleman from New Jersey. All those in favor will say aye. Aye. Those opposed say no. In chair, the ayes have it. The amendment is agreed to. Are there further amendments to the bill? Seeing none, the vote now occurs on H.R. 5197 as amended. All those in favor will say aye. Aye. Those opposed say no. Opinion chair, the ayes have it. The bill is adopted and forwarded. Chair will now call up H.R. 5261, which is number 17 on the list, as forwarded by the Subcommittee on Health on April 25th, and ask the clerk to report.
H.R. 5261, to amend the Public Health Service Act to provide for regional centers of excellence in substance use disorder education and for other purposes.
And without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Any amendments to the bill? Chair recognizes the gentleman from Ohio to strike the last word.
Yes, Mr. Chairman, I move to strike the last word, and thank you for the recognition. The Teach to Combat Addiction Act will increase the amount of education that health professional students get during their education on substance use disorder, pain management, and addiction. And I want to personally thank my colleague, Representative Tonko, for co-leading this bill with me. During the legislative hearing on this bill, we heard testimony that only 8% of U.S. medical schools require dedicated courses on addiction, and only a handful have robust curriculum on the diagnosis and treatment of substance use disorders. By recognizing institutions that have put a focus on these areas and sharing their strategies publicly, we hope to ensure that the next generation of healthcare professionals is fully prepared to address the opioid epidemic as well as other forms of addiction. The bill also includes a community outreach piece to ensure that educational institutions are working with frontline organizations in their communities to exchange expertise and strategies to address local needs.
These partnerships can be with local mental health or substance use disorder treatment providers, law enforcement, the business community, or others working on this epidemic. Our response to the opioid epidemic requires an all-hands-on-deck effort. Healthcare providers are in a unique position to recognize and start to address a patient suffering from addiction, and it's important that their training fully prepares them to play that important role. And Mr. Chairman, I would ask unanimous consent to enter 2 letters of support into the record, one from Addiction Policy Forum and one from numerous health profession schools. And with that, I yield back.
Without objection, it will be entered as part of the record. Chair will recognize the gentleman from New York, Mr. Tonko, to strike the last word. Recognized for 5 minutes.
Yes, Mr. Chair, I move to strike the last word. I rise in support of the Teach to Combat Addiction Act, which I joined with my friend from Ohio, Representative Bill Johnson, in introducing. This legislation will invest in our addiction infrastructure by helping to develop and disseminate model curricula to train our next generation of medical professionals on the practice of addiction. Empowering our healthcare workforce to better understand and effectively prevent and treat substance use disorder will yield dividends in our fight against the opioid epidemic. I am proud to work with Representative Johnson on this critical legislation that will strengthen the tools and information we use to educate the next generation of healthcare professionals. And I strongly urge the committee to favorably report this bill from committee. With that, Mr. Chair, I yield back.
Gentleman yields back. Other members wishing to speak on the bill? Seeing none, the vote occurs on H.R. 5261. All those in favor will say aye. Aye. Those opposed say no. Opinion share. The ayes have it. The bill is favorably reported. Chair now calls up H.R. 5272, which is number 18, as forwarded by the Subcommittee on Health on April 25th, and asks the clerk to report.
H.R. 5272, to ensure that programs and activities that are funded by a grant, cooperative agreement, loan, or loan guarantee from the Department of Health and Human Services, and whose purpose is to prevent or treat a mental health or substance use disorder, are evidence-based.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? Seeing none, the vote occurs on H.R. 5272. All those in favor will say aye. Aye. Those opposed say no. Opinion share. The ayes have it. The bill is favorably reported. Chair now calls up H.R. 5327, which is number 19 on your little schedule, as forwarded by the Subcommittee on Health on April 25th, and asks the clerk to report.
H.R. 5327, to amend Title 10 of the Public Health Service Act to establish a grant program to create comprehensive opioid recovery centers and for other purposes.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to the bill?
Mr. Chairman,
Gentleman has the bipartisan
I
amendment.
have a bipartisan amendment at the desk.
The clerk will report the title of the amendment.
Amendment to H.R. 5327, offered by Mr. Guthrie.
And the clerk will, the amendment will be considered as read. The staff will distribute the amendment, and the gentleman is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. I offer this bipartisan amendment as a technical clarification to the Comprehensive Opioid Recovery Center requirements. This amendment clarifies that the service may be contracted out in order to provide patients with proper resources to combat their disease of addiction. The current addiction treatment system in America is fragmented and composed of many types of settings, providing varying degrees of treatment services. Oversight of these providers ranges from none to minimal to extensive, depending on the location, type of setting, and the treatment offered to patients. Urge my colleagues to support this amendment. And while I have the time, I would like to also, if it's appropriate, to ask that a letter from the Addiction Policy Forum supporting this amendment and bill, a letter of support be entered into the record.
Without objection. Gentleman yields back.
I yield back.
Other members wish to speak on the amendment? Seeing none, the vote occurs on the amendment offered by the gentleman from Kentucky. All those in favor will say aye. Aye. Those opposed say no. Opinion chair, the ayes have it. The amendment is adopted. Are there further amendments to the bill? Gentleman from New Mexico.
Mr. Chairman, I have an amendment at the desk.
The clerk will report the title of the amendment.
Amendment to H.R. 5327, offered by Mr. Lujan.
And the amendment will be considered as read, and the staff will distribute the amendment, and the gentleman is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman, and thank you to Mr. Guthrie and Mr. Bouchon with working with myself and Mr. Green on this bill. This bill would fund at least 10 comprehensive opioid centers across the country. Now, we know 10 centers across 50 states will not solve this problem, but we hope that these centers can stand as examples for what other substance use disorder facilities could strive to be. Mr. Guthrie, I also want to personally thank you and your staff for working together to make sure prevention services are part of these centers. I think this amendment that we have here is a strong addition, and again, want to recognize Mr. Guthrie and his staff for their leadership and their work. This amendment, which I truly believe we can all support, requires these centers to either provide directly or contract out prevention services for two specific and important groups. One, prevention services for family members of those diagnosed with substance use disorder. Two, targeted intervention services for opioid-dependent chronic pain patients without a terminal illness. That's it. Prevention for people whose family members suffer from addiction, and early intervention for people who suffer from chronic pain and are dependent upon their opioid prescription. Public health research shows us that intervening with these two groups can prevent thousands of people from suffering from substance use disorder down the line. And that's really what we're trying to do here with this bill. Provide more families hope for a future without substance use disorder. I think this bill is a step in the right direction. Thank you very much, and I yield back, Mr. Chairman.
Gentlemen, yield?
I would yield.
I just want to my colleagues to say I support this amendment. I appreciate your staff working together with us, and I urge my colleagues to vote for this amendment.
Thank you, Mr. Guthrie, and I would yield to Ms. Castro of Florida.
I also want to thank you, Mr. Guthrie and Mr. Lujan, and the other co-sponsors here. This is a step in the right direction, but I want to make the point that these grants will not be enough. Over time, we really need what folks are saying at home and across the country. They need the consistent, dependable funding and resources to really tackle this crisis. And while this is a good step forward, we need to think in more robust and bold terms moving ahead. Thank you again, and I yield back.
I yield back, Mr. Chairman.
Gentleman yields back. Other members wishing to speak on the amendment? Seeing none, the vote occurs on the amendment offered by the gentleman from New Mexico, Mr. Lujan. All those in favor will say aye. Aye. Those opposed say no. Opinion of the chair, the ayes have it. The amendment is agreed to. Further amendments to the bill?
Mr. Chairman, I move to strike the last word.
Gentleman is recognized for 5 minutes.
Mr. Chairman, I speak in support of H.R. 5327 as amended in the Comprehensive Opioid Recovery Centers Act. This legislation creates a unique model of patient-centered care designed to address the opioid crisis. The Comprehensive Opioid Recovery Centers Act, when enacted, will provide full range of treatment for options for patients suffering from opioid addiction and other substance use disorders. Designated centers will receive grants, and their designation through SAMHSA will be required to provide wide range of evidence-based treatment services as well as recovery support programs. These services include, but are not limited to, all FDA-approved medications, detoxification, counseling, residential rehab, recovery housing, community-based, and peer recovery support system, and job training and placement assistance. I thank my colleagues, both Congressman Guthrie, Congressman Lujan, and Congressman Bouchon for their hard work and cooperation on this valuable legislation. As my colleagues support this bill, it clarifies also that the methadone services could be conducted by referral if needed. Our goal is to establish centers like this that would be the gold standard for treatment in all parts of the country, and so we can get some kind of clarity on how we treat all these different illnesses. I urge my colleagues to support this valuable legislation and yield back the remainder of my time.
Gentleman yields back. Other members wishing to speak on the bill? Further amendments to the bill? Seeing none, the vote occurs on H.R. 5327 as amended. All those in favor will say aye. Aye. Those opposed say no. You chair, the ayes have it. The bill is favorably reported. Chair now calls up H.R. 5353, number 20, as forwarded by the Subcommittee on Health on April 25th, and asks the clerk to report.
To H.R. 5353, to amend the Public Health Service Act to reauthorize and expand a program of surveillance and education carried out by the Centers for Disease Control and Prevention regarding infections associated with injection drug use.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? Seeing none, the vote occurs on favorably reporting H.R. 5353. All those in favor will say aye. Aye. Those opposed say no. Opinion chair, the ayes have it. The bill is favorably reported. Chair now calls up H.R. 3331, number 21 on your list, and asks the clerk to report.
H.R. 3331, to amend Title 11 of the Social Security Act to promote testing of incentive payments for behavioral health providers for adoption and use of certified electronic health record technology.
And without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? The chair recognizes the gentlelady from California, Ms. Matsui.
Thank you, Mr. Chairman. I have a bipartisan amendment at the desk, an amendment in the nature of a substitute to H.R. 3331.
And the clerk will report the title of the amendment.
Amendment in the nature of a substitute to H.R. 3331, offered by Ms. Matsui.
And the amendment will be considered as read. Staff will distribute the amendment, and the gentlelady is recognized for 5 minutes.
Thank you, Mr. Chairman. Mr. Chairman, I'm pleased to work on this legislation with my colleagues, Representative Lynn Jenkins from the Ways and Means Committee and Representative Mullen here, as well as Ranking Member Pallone and Chairman Walden. Just yesterday, Senator Whitehouse and Portman championed this bill's passage in the Senate. The amendment at the desk makes some technical changes to the bill, including conforming changes to the Senate version and updates based on feedback from CMS. Additionally, we have added psychiatric nurse practitioners to the list of providers that may potentially qualify for a CMMI demonstration under this bill. We must continue to push for our health system to include behavioral health treatment as a part of regular medical care. Ensuring that behavioral health providers have electronic health records is one step in that direction. I thank my colleagues for working with me on this important legislation. I urge support on this bipartisan bill, and I yield back.
Gentlelady yields back. Other members wishing to speak on the amendment? Seeing none, the vote occurs on the amendment offered by the gentlelady from California. All those in favor will say aye. Aye. Those opposed say no. Opinion chair, the ayes have it. The amendment is agreed to. Are there further amendments to H.R. 3331? Seeing none, the vote occurs on H.R. 3331 as amended. All those in favor will say aye. Aye. Those opposed say no. Opinion chair, the ayes have it. The bill is favorably reported. Chair now calls up H.R. 5685, number 22 on your list, and asks the clerk to report.
H.R. 5685, to amend Title 18 of the Social Security Act to provide educational resources regarding opioid use and pain management as part of the Medicare and U Handbook.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? Seeing none, the vote occurs on favorably reporting H.R. 5685. All those in favor will say aye. Aye. Those opposed say no. Can you chair, the ayes have it. The bill is favorably reported. Chair now will call up H.R. 5603, number 23 on your list, and that's, nope, we're not calling that. Pause. Chair will call up instead H.R. 3528, number 24 on your list, as forwarded by the Subcommittee on Health on April 25th, and will ask the clerk to report on H.R. 3528.
H.R. 3528, to amend Title 18 of the Social Security Act to require e-prescribing for coverage under Part D of the Medicare program of prescription drugs that are controlled substances.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? Seeing none, the vote occurs on favorably reporting H.R. 3528. Oh, there is? Who's got the, Mr. Mullen? I will call up the amendment. We have an amendment, number, which one is it? Offered by Mr. Mullen. I'm going to offer the Mullen amendment.
Amendment
Number
to
36.
Amendment to H.R. 3528, offered by Mr. Upton.
The amendment will be considered as read. The staff will distribute the amendment, and I will be recognized for 5 minutes in support of the Mullen amendment. It's a technical amendment, right? It's told that it's a technical amendment. It's been cleared with both sides. It shouldn't be any problem. I would urge my colleagues to support it. In the absence of Mr. Mullen, who is, yes. And I will yield to my friend and colleague to also speak in favor of the Mullen amendment as offered by Mr. Upton, the gentleman from New Jersey, Mr. Plone.
Thank you, Mr. Chairman. I support the Mullen amendment, but I really am speaking on the underlying bill. As I noted during our subcommittee markup, I believe this legislation has the potential to reduce abuse and diversion of prescription opioid medications by requiring that prescriptions for controlled substances covered under Medicare Part D be electronically prescribed and transmitted securely for dispensing. As I've reiterated throughout the committee's consideration of these opioid proposals, I intend to support legislation that either directly impacts treatment or will meaningfully prevent the spread of opioid addiction. And I believe that this bill is one of the proposals that can have a very real preventative impact by utilizing the technology we have to ensure legitimate prescriptions for controlled substances are not forged or tampered with, but instead are delivered securely through an electronic means to the dispensing pharmacy. I'm aware that some are concerned that this legislation may result in additional burdens on prescribers, and I'm sympathetic to those concerns, but also believe that this bill could be a way to reduce diversion and fraud, while also ensuring patients that need their covered prescriptions are still able to obtain them. So I'm pleased that H.R. 3528 is bipartisan. I thank Ms. Clark and Mr. Mullen for their leadership on this bill, and I stand ready to continue to work with my colleagues on this legislation as needed. But the underlying bill is really, I think, important, and I urge my colleagues to support it.
Gentleman yields back. Are there other members wishing to speak on the Mullen amendment as offered by Mr. Upton? Seeing none, the vote occurs on that amendment. Those in favor will say aye. Aye. Those opposed say no. Opinion Chair, the ayes have it. The amendment is agreed to. Are there further amendments to H.R. 3528? Seeing none, the vote occurs on H.R. 3528 as amended. All those in favor will say aye. Aye. Those opposed say no. Opinion Chair, the ayes have it. The bill is favorably reported. Now the chair calls up H.R. 4841, which is number 25 on your list, and asks the clerk to report.
H.R. 4841, to amend Title 18 of the Social Security Act to provide for electronic prior authorization under Medicare Part D for covered Part D drugs and for other purposes.
And without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? Gentleman from New Mexico.
I was not certain if Mr. Johnson was going to offer. If not, I'd be happy to offer the amendment.
Mr. Johnson has got an amendment at the desk. The clerk will report the title of the amendment.
Amendment to H.R. 4841, offered by Mr. Johnson.
And the amendment will be considered as read. The staff will distribute the amendment, and the gentleman from Ohio is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. This amendment makes a small clarifying change to the base text of the Standardizing Electronic Prior Authorization for Safe Prescribing Act. This bill will improve efficiencies in Medicare and allow beneficiaries to begin doctor-prescribed therapies without delay. There are a number of medications that require approval by a health insurance plan prior to dispensing in order to ensure coverage, a process known as prior authorization, or PA. However, the traditional PA process uses outdated modes of communication such as phone and fax, which can be burdensome for the provider and pharmacist and often causes undue delays for the patient. Electronic prior authorization, or EPA, has seen widespread and successful adoption in the commercial market, and this legislation takes an important step to further encourage its adoption in Medicare Part D. EPA provides a pathway for a quick determination of clinical appropriateness, assisting in the prevention of prescription misuse while maintaining access to medications for those with legitimate needs, which is particularly impactful in the opioid prescription space. I urge my colleagues to support this technical amendment as well as the underlying legislation. And I have, Mr. Chairman, I would like to offer with unanimous consent, enter into the record a letter from supporters. We have over a dozen supporters from companies American Academy of Ophthalmology, AstraZeneca, Athena Health, Global Healthy Living Foundation, IBM, Healthcare Leadership Council, National Association for Mental Illness, Patients Rising Now, and Pharmaceutical Care Management Association, and I request that that letter of support be entered into the record, and with that, I yield back.
Without objection, will be entered in part of the record. Gentleman from New Mexico.
Strike the last word, Mr. Chairman.
Gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman, and thank you, Mr. Johnson, for your work and your leadership on this initiative as well. This legislation improves the prior authorization of medications to the Medicare program by streamlining the PA process and ensuring legitimate beneficiary access to prescribed medication under PA, such as many opioids. Most importantly, a more efficient PA process will help to improve health outcomes and reduce overall health costs. The amendment that Mr. Johnson and I are offering today are simply two technical fixes. Applying electronic prior authorization to the Medicare Part D program would reduce provider burdens, improve patient access and adherence, and decrease systems costs. And I think this is something we can all stand behind. And with that, Mr. Chairman, I yield back.
Gentleman yields back balance of his time. Other members seeking recognition on the amendment? Seeing none, the question now arises on passing the amendment. All those in favor of the Johnson amendment will say aye. Those opposed, nay. The ayes appear to have it. The ayes have it. The amendment's adopted. Any other member seeking recognition on this legislation or any other amendments? Seeing none, the vote now arises on approving and reporting H.R. 4841 as amended to the House floor favorably. All those in favor shall say aye. Aye. Those opposed, nay. The ayes appear to have it. The ayes have it, and the bill is reported as amended. Next up, the chair calls up H.R. 5675, number 26 on your program, and asks the clerk to report.
H.R. 5675, to amend Title 18 of the Social Security Act to require prescription drug plan sponsors under the Medicare program to establish drug management programs for at-risk beneficiaries.
Without objection, the first reading of the bill is dispensed with. The bill is open for amendment at any point. Are there any bipartisan amendments to this legislation? Are there any amendments? Anyone seeking recognition? Chair recognizes the gentleman from Florida for 5 minutes. Strike the last word.
Thank you, Mr. Chairman. I appreciate it. Mr. Chairman, thanks for including H.R. 5675 in this markup. Appreciate it so much. This bill was introduced by myself and my good friend Ben Ray Lujan, along with Peter Roscom and Sander Levin, so it's truly a bipartisan bill. This bill is a simple tweak to the already existing Medicare lock-in program. Back in 2013, myself and Ben Ray Lujan introduced the Patient Safety and Drug Abuse Prevention Act, which would create a pharmacy lock-in program in Medicare. This provision was ultimately included in the CARE, the Comprehensive Addiction Recovery Act, in 2016. Pharmacy lock-in is not a new concept, as you know. States have been using physician or pharmacy lock-in or some combination of both as part of Medicaid for years. So the TRICARE uses it, and so do commercial insurance. This law, as it stands, has a may authority. This bill will change it to a shall authority. Right now, it is up to the discretion of the Part D plan that they may run a lock-in program or may not run a lock-in program. This legislation will require that all Part D plans have a pharmacy lock-in program in place for at-risk beneficiaries. This is a common-sense tweak to the law. Beneficiaries have the ability to switch plans every year. At-risk beneficiaries would simply find prescription drug plans that do not have a lock-in program in place and use those plans to continue their drug diversion habits inside Medicare under the current law. This particular bill ensures that we have a uniform system in place across Part D, and that all beneficiaries who are at risk, again, at-risk beneficiaries, can be identified and ensured that they receive the assistance they need. In 2012, an estimated 336,000 seniors had misused or become dependent upon prescription pain relievers, according to SAMHSA. We need to do all we can to help our seniors in Medicare, Mr. Chairman. This bill makes the law better, and I ask swift passage, and I yield back the balance.
The gentleman yield.
Thank you so much. Yes, please. I yield. I yield to my good friend Ben Ray.
I thank Mr. Bilrakis, and as my friend pointed out, this bill we are considering today will build off of work done in the Comprehensive Addiction Recovery Act. I want to quickly thank my partner and friend on this bill, Mr. Gus Bilrakis, and his staff for working on this issue together. This bill is an important step forward to help our seniors stay as safe as possible when it comes to prescription opioids. As we know, seniors represent a growing percentage of people with substance use disorder. I'm proud to continue the bipartisan work we started last Congress, and I hope all my colleagues can also support this important legislation. I would yield back to Mr. Bilrakis.
Yes, and I yield back the balance of my time,
yields
Mr.
back the
Chairman.
balance of his time. Are there other members seeking recognition? Seeing none, the question now arises on reporting favorably. H.R. 5675 as amended to the House. All those in favor will signify by saying aye. Aye. Those opposed, nay. The ayes appear to have it. The ayes have it, and the bill is reported favorably to the House. Chair now calls up H.R. 5686, number 27 on the list, and asks the clerk to report.
H.R. 5686 to amend Title 18 of the Social Security Act to require prescription drug plans under Medicare Part D to include information on the adverse effects of opioid overutilization and of coverage of non-pharmacological therapies and non-opioid medications or devices used to treat pain.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments?
I move to strike the last word.
Gentleman's recognized for 5 minutes. Strike the last word.
Thank you, Mr. Chairman. When it comes to combating the opioid epidemic, education and awareness are core components. A lack of knowledge for consumers and prescribers has left many of our communities in crisis. Years ago, we did not fully understand the neurobiology behind opioid use, especially when they are taken for a prolonged period. Because of that, opioids were the gold standard in pain management and became a commonly prescribed drug. We also didn't realize that these drugs have different impacts on different demographics. Take seniors, for example. According to the Substance Abuse and Mental Health Services Administration, opioid use can cause breathing complications, confusion, drug interaction problems, and increased risk of falls. All of these side effects are already more dangerous in older populations, putting our seniors at greater risk. In addition, a 2016 analysis by HHS Inspector General found that over 500,000 Medicare Part D beneficiaries received what they would consider a high amount of opioids, with the average dose far exceeding the manufacturer's recommended amount. It is estimated that roughly 1 in 3 beneficiaries receives a prescription for opioids. It's also estimated that nearly half of older Americans suffer from a chronic pain condition, which typically becomes more common and severe as we age. Yet despite the risks, opioids can be a valuable tool in pain management, so long as they are being prescribed and used properly. We need to make sure that patients understand the risks of overutilization of these prescriptions, as well as available treatment options. Ensuring that Americans are presented with the information to make their own decisions is important. That is why I was proud to join Representative Paulson, Kind, and Lamb in introducing the Choice Act. This bipartisan legislation will help Medicare beneficiaries make informed decisions on pain management. The policy idea is simple. If a person is informed about the dangers that can come with taking prescription opioids, they are likely to discuss their prescriptions with their physicians. This will lead both the patient and the doctor to be more cognizant of the early warning signs of addiction. The Choice Act will require Medicare Part D plans to annually inform patients about the adverse effects associated with prolonged opioid use. In addition, these notices will provide information on other options, like non-pharmacological therapies, devices, and non-opioid medications. I'm hopeful that this legislation will encourage more patients to talk to their doctors about the risk for addiction and other treatments available in order to prevent addiction from occurring. I yield back.
Gentleman yields back the balance of his time. Are there other members seeking recognition on H.R. 5686? Are there any offers of amendments? Hearing and seeing none, the question now arises on favorably reporting H.R. 5686 to the floor. All those in favor will signify by saying aye. Aye. Those opposed, nay. The ayes appear to have it. The ayes have it, and the measure is reported favorably to the House. The chair calls up H.R. 5582, number 28 on your list, and asks the clerk to report.
H.R. 5582, to direct the Secretary of Health and Human Services to conduct a study and submit a report on barriers to accessing abuse-deterrent opioid formulations for individuals enrolled in a plan under Part C or D of the Medicare program.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there bipartisan amendments to the bill?
Mr. Chairman, I have an amendment.
The gentleman's recognized. The clerk will report the amendment.
Amendment to H.R. 5582, offered by Mr. Carter.
Gentleman's without further objection, further reading of the amendment is dispensed with. The chair recognizes the gentleman from Georgia, Mr. Carter, for 5 minutes to speak in support of his amendment.
Thank you, Mr. Chairman. Mr. Chairman, this amendment makes 3 simple changes to the underlying legislation that was reported out of subcommittee. This amendment extends the deadline for CMS to conduct the study to 1 year. It includes the term prodrug as an example of ADFs, and it includes list price as a potential barrier to accessing ADFs. Each year, approximately 4.5 million Americans use prescription pain medications for non-medical purposes, contributing to 89 deaths per day. Of those that misuse prescription pain relievers, 53% reported obtaining them from friends or relatives. Although past legislative efforts have encouraged innovation in prescription drug regulation, law enforcement, and education, there are still individuals who have severe legitimate chronic pain and need access to opioids. Abuse deterrent formulations, or ADFs, represent a breakthrough technology for these individuals that helps prevent the crushing, snorting, and injection of painkillers. Currently, many prescription drug plans present barriers to ADFs, including cost-sharing tiers, fail-first requirements, prior authorization requirements, and list price, all limiting patient access to abuse-deterrent formulations. Instead of receiving ADFs, many patients are limited to using opioids that can be easily crushed, snorted, and injections. Solutions to this public health crisis must balance the need to preserve access to effective pain medications for legitimate patients living with pain while minimizing the risk of opioid misuse and abuse that occurs in our communities. ADF should be an integral component of a comprehensive prescription opioid misuse, abuse, and diversion prevention strategy designed to limit harm for patients, abusers, and the surrounding community. I'm proud to introduce this with my colleague across the aisle, Representative Loebsack, and my Ways and Means colleague, Representative Reed, and I urge your support. And I yield back.
Gentleman yields back the balance of time. Chair recognizes the gentleman from Pennsylvania. Strike the last word.
Thank you, Mr. Chairman. I want to speak in support of this bill. We all know that the opioid crisis can't be solved with one single bill, which is why we're here today. And I believe that none of us are under any delusion that we have a silver bullet solution. And I don't believe that abuse-deterrent opioids are such a solution. However, I do believe they can be a small part of our approach to tackle this problem from many different directions. While these drugs are not less addictive, these medicines can be helpful to keep patients from taking pills inappropriately, whether through crushing, injecting, or snorting. We should be giving doctors and patients every tool possible to help mitigate this process. This bill will help us get a sense of how many patients have access to ADF drugs, which may help us address the increased need or demand going forward. I'm happy to see the bill included in this package. I look forward to working with the committee and Mr. Carter as we continue this process. I want to thank you and yield back the balance of my time.
Chairman yields back. Are there members on the majority side seeking recognition? Seeing none, Chair recognizes Gentlelady from Illinois, Ms. Schakowsky, for 5 minutes. Strike the last word.
Thank you, Mr. Chairman. I am very encouraged that this amendment includes the cost of abuse deterrent formulation drugs in the study, and I'm grateful to Representative Carter for working in a bipartisan manner to include a price study in this bill. I do still believe that we need to examine the price of naloxone products to see how the skyrocketing prices have impacted access to that life-saving drug. Generic and brand formulations of naloxone have seen huge price increases within the last few years. The generic version now sells for double its price, and Evzio has increased its price 500%. With the increased demand on these drugs to equip police, emergency medical providers, schools, families, and friends, the burden on public programs has increased as well. We need to know how these price increases are affecting access. Additionally, we should give the Secretary of HHS every tool he needs to address this public health emergency, especially the authority to negotiate the price of naloxone. President Trump is announcing his plan to address rising drug prices on Friday, and there are many things I hope he includes, but one area we should all be unified on is lowering the price of naloxone through negotiation. We cannot allow pharmaceutical corporations to profit from this epidemic. It is unacceptable. I hope as we move forward with next week's markup, we can continue to discuss how we can lower the barriers to accessing naloxone. Because we can't afford naloxone, because when we can't afford naloxone and it is not available, people die. Thank you, and I yield back.
Gentlelady yields back. Other members seeking recognition to speak on the legislation. The chair recognizes the gentleman from Iowa, Mr. Loebsack, for 5 minutes. Strike the last word.
Thank you, Mr. Chair. Just very quickly, I'm really happy to work with my good friend Buddy Carter on this and colleague Buddy Carter. He's done a great job on this. We've worked together on a number of issues. I know we're going to continue to do so, especially on the committee pharmacy issues, but others as well. And I think he's explained not only the underlying bill, but the amendment very well. And I appreciate the bipartisan support on this side of the aisle, too. So thank you, Mr. Carter, and thank you, Mr. Chair, and I yield back.
Gentleman yields back. Are there other members seeking recognition to speak on this amendment? Seeing none, the question now arises on approving the amendment. All those in favor will say aye. Aye. Those opposed, nay. The ayes appear to have it. The ayes have it. The amendment's adopted. There are further amendments to H.R. 5582. Seeing none, the question now arises on reporting to the full House as amended H.R. 5582 and doing so favorably. Those in favor will signify by saying aye. Aye. Those opposed, nay. The ayes appear to have it. The ayes have it, and the bill is reported to the House favorably as amended. Chair calls up H.R. 5684. This would be number 29 on the list, and asks the clerk to report.
H.R. 5684, to amend Title 18 of the Social Security Act to expand eligibility for medication therapy management programs established under Part D of the Medicare program to include certain individuals who are at risk for prescription drug abuse.
Chair, without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? For what purpose do gentlemen from Texas seek recognition?
Well, move strike the last word.
Recognize Chairman of the Subcommittee on Health for the next 5 minutes. Strike the last word.
Thanks, Chairman. And I do want to commend our colleague, Kathy Morris-Rogers, and members on both sides of the dais on this committee and the Ways and Means Committee for working on this legislation. Medication therapy management has been shown to improve patient outcomes and lower health care costs. This bill would expand medication therapy management by adding those at risk for prescription drug abuse to the list of targeted beneficiaries eligible for medication therapy management services under the Medicare Part D program. Mr. Chairman, I have a letter from the American Medical Association actually detailing support for a number of the bills that we're working on today, but this one in particular. So I'd ask unanimous consent to place
Without
the
objection.
AMA letter into the record. And I urge members on both sides of the dais to support this important legislation. And again, thank our colleagues on Ways and Means. I yield back.
Gentleman yields back. Are there other members seeking recognition? The chair recognizes the gentleman from Pennsylvania for 5 minutes to strike the last word.
Thank you, Mr. Chairman. I want to speak in support of H.R. 5684. Again, I think this bill can be a small piece of the puzzle in addressing the opioid epidemic. Medicare currently offers medication therapy management for beneficiaries with complex health needs. This program helps both patients and doctors make sure that medications are working to improve their health. Under an MTM program, a pharmacist can give beneficiaries a comprehensive review of all of their medications and talk about how well they are working, side effects, potential interactions between drugs, and any other problems that they may be having. Currently, this program is only available for certain Medicare beneficiaries with multiple chronic conditions or taking several medications. But the program could also be used to help prevent opioid abuse in at-risk beneficiaries. In fact, CMS encourages plans to offer MTM services to beneficiaries who are at risk for substance use disorder. Our bill would expand eligibility to medication therapy management programs for Medicare beneficiaries who are at risk for prescription drug abuse as determined by the Secretary. I think that this type of service could really help people understand the drugs they're taking and help foster important conversations between patients and providers. Again, I appreciate the work of the committee. I look forward to seeing this bill move forward. I want to thank you, Mr. Chairman, and I yield back my time.
Gentleman yields back. Other members seeking recognition on this legislation? Seeing none, the question now arises on favorably reporting H.R. 5684 to the House as amended. All those in favor, did we amend that? No, I'm sorry. On favorably reporting H.R. 5684 to the House. All those in favor will signify by saying aye. Aye. Those opposed, nay. The ayes appear to have it. The ayes have it, and H.R. 5684 is approved. The chair now calls up H.R. 5333. This is number 30 on your list, and asks the clerk to report.
H.R. 5333, to amend the Federal Food, Drug, and Cosmetic Act to clarify the regulatory framework with respect to certain non-prescription drugs that are marketed without an approved new drug application and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. Are there any bipartisan amendments?
Mr. Chairman, bipartisan.
For what purpose, the gentleman from Ohio seek recognition?
I have a bipartisan
Clerk will
amendment.
report the amendment.
Amendment to H.R. 5333, offered by Mr. Latta.
Without objection, further reading of the amendment is dispensed with. The chair recognizes the gentleman from Ohio, Mr. Latta, to speak on the amendment for the next 5 minutes.
Move to strike the last word, Mr. Chairman.
Without objection.
Thank you, Mr. Chairman. My amendment to H.R. 5333 makes technical changes to the underlying bill to better articulate the true intent of Congress in modernizing the OTC monograph framework. These bipartisan changes reflect guidance we received from stakeholders and technical assistance provided by the FDA. The amendment also adds a provision from my friend, the gentlelady from Colorado, Ms. DeGette, that would require GAO to conduct a study to evaluate the impact of exclusivity on the OTC markets and consumers. And also, Mr. Chairman, I'd ask unanimous consent to submit for the record a number of letters of support.
Without objection.
Mr. Chairman, those letters of support come from the American Academy of Allergy, Asthma, and Immunology, the American Academy of Pediatrics, the American Public Health Association, the Consumer Healthcare Products Association, the March of Dimes, the National Association of County and City Health Officials, the Pew Charitable Trust, the Society for Maternal Fetal Medicine, GSK Consumer Healthcare, and the American Dental Association. And those are the letters I'd like to submit, Mr. Chairman.
Yes, without objection.
Thank you.
Does the gentleman yield back, or is he? Gentleman yield back the balance of his time?
I yield back, Mr. Chairman.
Gentleman yields back. Chair now recognizes the gentleman from Texas, Mr. Green, for 5 minutes. Strike the last word.
Strike the last word and speak in support of both H.R. 5333, the over-the-counter monograph Safety Innovation Reform Act, and also this amendment. The legislation was carefully drafted over several years and reflects the hard work of this Congress and the FDA and other stakeholders. I particularly want to thank my colleagues in the FDA who have spent countless hours on this legislation to strike the appropriate balance to benefit consumers and provide FDA with the necessary resources to expedite safety, labeling changes, and accommodation innovation. It's important to note that until recently, over-the-counter drugs, which comprise 60% of all medicines sold in the United States, were overseen by only 18 full-time employees at the FDA, with a budget of just $8 million a year. These user fee programs authorized by this legislation will enhance FDA's ability to respond swiftly and effectively to safety concerns, review OTC ingredient applications in a timely manner, and encourage sponsors to submit OTC innovations. I know there's concerns about the length of time, including in this legislation, which is an innovative OTC product that would be on the shelves without store brand competition. It's important to remember that exclusivity in this legislation is not the same as exclusivity for new medications. Consumers will still have the same access to affordable store brand products. Additionally, the exclusivity provided under this legislation, which would just be 18 months, 6 months less than the Senate bill. I ask everyone, in addition, to support the amendment. We will be considering the amendment will add a GAO study at the recommendation of Congresswoman DeGette on the effectiveness and overall impact of exclusivity, including its impact on consumer access. I want to thank Representative Latta for leading the effort with me, along with Congresswoman DeGette, Dingell, and Congressman Chair Burgess, and also Congressman Guthrie. I also like to thank Ranking Member Lavone, who's been instrumental in this effort, and Chair Waldron for his work on this issue. And I yield back my balance of my time. I'll be glad to yield time to my colleague from Colorado.
Thank you. Thank you. I thank the gentleman for yielding, and I thank him for his leadership on this bill. This is a really important piece of legislation, and I know we're moving quickly, but we need to see why we're doing this bill. In 2015, the average U.S. household spent $338 on OTC products like cough and cold medicine, but they're regulated through an antiquated 40-year monograph system. This system struggles to effectively keep up with emerging safety issues, which can cause serious risks for consumers. For example, in 2006, the FDA learned that common cough medications tragically caused several toddlers to die. Then, the agency spent a decade trying to update the monograph for cough medications to warn parents about the health risks, but the agency was unsuccessful in overcoming the burdensome and time-consuming process. So this is really going to be a wonderful piece of legislation for family safety. I want to thank the FDA for their technical assistance and for working on this. And I just want to say one thing about this amendment, which includes my language for a GAO study of the OTC bill's exclusivity language. Here's a situation where everybody agrees we need to have some exclusivity, but nobody agrees what the amount should be in this context. As Mr. Green said, it's not the same type of exclusivity that we see with prescription drugs. And when we were having this debate, it became clear to me that nobody really knows exactly what the number should be. The Senate bill has 24 months, as does this underlying bill. Mr. Pallone feels quite strongly it should be 12 months, and I know he has an amendment. And so we sort of compromised at 18 months, but we don't even know if that's the sweet spot to both encourage innovation but also keep consumer costs low. And so that's why I don't usually like studies, but that's why I suggested this particular GAO study, and I'm happy that it's included in the manager's amendment. I would urge everybody to support this amendment and then to support the underlying bill. It's really an important piece of legislation, and I hope we can get it through both bodies and signed by the President as soon as possible. With that, I yield back.
Mr. Chairman, reclaiming my time, I think this shows what the Energy and Commerce Committee can do as a whole. When we work together across party lines, we come to compromises, and that's why I'm so proud of being on this committee, and I yield back my time.
We appreciate that, and that's our goal. Thank you. And the gentleman yields back the balance of his time. Are there other members seeking recognition on the amendment? If not, I'm sorry. Gentlelady from Michigan is recognized for 5 minutes to speak on the amendment.
Strike the last word. Mr. Chairman, I'm proud to support H.R. 533, the Over-the-Counter Monograph Safety, Innovation, and Reform Act, and to support my colleague from Ohio's amendment. This committee has been focused on reforming the OTC monograph system for many years, before I ever got here. The work began with the passage of the Sunscreen Innovation Act in 2014, legislation which was written in this committee and championed by somebody I may know and love. Passage of the OTC bill today finishes the work that a lot of people have put a lot of blood, sweat, and tears into. As others have previously noted, the current rulemaking process has prevented FDA from updating many OTC monographs, which is problematic for many reasons. Not only does it make it harder for innovative products like new sunscreens to come to market, but it also makes it nearly impossible for FDA to amend existing monographs if they see safety concerns in certain products. We need to make sure FDA has the ability to act quickly if they see unsafe products and protect the consumer. Pure and simple, the current system is broken. It doesn't work for patients, it doesn't work for companies, it doesn't work for FDA. From past experience, we know that user fee programs have been very successful at FDA, and this bill extends that successful model. I do know that there's been a lot of discussion about the exclusivity provisions of this legislation. If it was up to me, I would lower the number, and I will support Ranking Member Pallone in his efforts to do so. But ultimately, it's a compromise. And compromise is a good word, not a dirty word. I support this legislation as drafted today with 18 months of exclusivity. I'll be the first to admit we could continue to make it better, but as my colleague, Representative Green saying, this committee knows how to work together. On balance, and it's important, the public health benefits outweigh any of their concerns. Americans deserve safe products on the market. They deserve innovative products on the market. And I'm proud to say this legislation accomplishes these goals. I'm proud to work with my colleagues Bob Latta, Diana DeGette, Brett Guthrie, Jean Green, and Dr. Burgess. A lot of people put a lot of hard work into this. I thank everybody and the staff for their tireless work on this. I urge support of this legislation and yield back the balance of my time.
General Lay yields back the balance of her time. Other members seeking to speak on the amendment? Seeing none, will now take up passage of the amendment. All those in favor will say aye. Aye. Those opposed, nay. The ayes appear to have it. The ayes have it. The amendment's adopted. The chair recognizes the gentleman from New Jersey for 5 minutes.
Thank you, Mr. Chairman. I move strike the last word to discuss the underlying bill.
Gentleman's recognized.
Thank you. This legislation would reform the current monograph system that is used to legally market over-the-counter drugs and would create a user fee program to provide stable resources for the Food and Drug Administration to achieve such reform. And I want to thank Chairman Burgess as well as Ranking Member Green, Representatives DeGette, Latta, Guthrie, and Dingell for your work in crafting a proposal that will accomplish these goals. We've heard from FDA and industry that the current monograph system is woefully outdated and unwieldy, making it difficult for the agency to finalize, revise, or update monographs to reflect innovations or changes in science or to respond to safety issues. Industry has also expressed concerns that the current monograph process does not lend itself well to evolving science and technology and therefore discourages innovation. The case for regulatory reform is clear, but it can't be achieved without stable and reliable funding that reflects the growth and size of the over-the-counter industry. Today, the over-the-counter monograph program oversees more than 100,000 products with a staff of about 30 people and a budget of just over $8 million. H.R. 5333 establishes an over-the-counter user fee program that will provide the agency with resources to transition the monograph program, provide for additional capacity, and enable innovation and safety changes in the current market. While I'm supportive of monograph reform and the establishment of a user fee program, I remain concerned about the inclusion of an exclusivity award in the bill. It's been made clear to me that industry sees such an award as the only way to support providing the agency with the resources needed to bring this program into the modern era. The expansion of exclusivity is not something I take lightly. I've in the past supported exclusivity when I have found that the current market or regulatory pathway is not working as it should. However, this was after the market or current regulatory pathway demonstrated a failing, not before the pathway was even realized. To me, the more responsible policy approach would be to establish the administrative order procedure for industry-initiated innovation and examine how such pathway is working first before considering whether or not to grant exclusivity. And I'm also disappointed that we're not taking action today on cosmetics. Millions of Americans use cosmetic products every day, yet FDA's current regulatory authority in this area has not been updated for 30 years. In just the last year, millions of women and children have been exposed to shampoos that cause extraordinary hair loss, lip balm that can cause blistering and rashes, and eye shimmer and makeup tainted by asbestos. Unfortunately, FDA does not have the authority today to hold these manufacturers responsible and has very little ability to ensure that cosmetics are safe. This cannot continue, and I hope that when we complete our work on this issue, we can move forward to provide FDA with the tools and resources needed to oversee the rapidly growing and evolving cosmetic industry. We shouldn't stand idly by as American families and children are exposed to contaminated and tainted personal care products. But I support the underlying legislation, Mr. Chairman, and yield back.
Gentleman yields back. Are there other members seeking recognition on this legislation? If not, then the question now.
I have an amendment.
Oh, okay. Gentleman is recognized on, for what purpose does the gentleman seek recognition?
I have an amendment at the desk, which I guess is amendment number 1.
The clerk will report the amendment.
Amendment to H.R. 5333, offered by Mr. Pallone.
Without objection, further reading of the amendment is dispensed with. The chair recognizes the gentleman from New Jersey, Mr. Pallone, for 5 minutes to speak in support of his amendment.
Thank you, Mr. Chairman. This is an amendment on the exclusivity issue. As I've mentioned, I've been skeptical since industry first came to me with this proposal that exclusivity was truly needed or warranted to incentivize innovation in this market. It's especially true as the over-the-counter monograph reform legislation that we're considering today includes for the first time a pathway by which industry could initiate innovation for over-the-counter drugs. I've struggled to support exclusivity in this space given the fact that industry has been very open about the fact that they are demanding exclusivity in exchange for paying user fees. Since the introduction of the discussion draft, industry has offered a number of different justifications for exclusivity, such as negotiations with retailers may be lengthy, private label competition could begin right after an innovative product is launched, industry needs time to recoup their investment into innovation, or the most recent, that industry needs time to build inventory. In no other user fee legislation was a user fee program created simultaneously with the award of exclusivity. In fact, exclusivity has only ever been contemplated when there has been evidence that the current marketplace was not working as intended to incentivize needed innovation. This was true when Congress extended 6 months of exclusivity to manufacturers that conduct pediatric studies, and more recently when Congress extended 6 months of exclusivity to generic manufacturers that develop a competitor to current sole source drug products. But the current over-the-counter monograph reform legislation abandons this precedent and would award 18 months of exclusivity before even knowing if the industry-initiated innovation pathway works. Now, I'm concerned about this precedent and concerned about awarding an arbitrary period of exclusivity for a category of products without a compelling justification. While I've supported incentives in the past to encourage certain development and innovation, it's been after a compelling case has been made that the current marketplace and regulatory pathways were not working. In considering such proposals, I've also always wanted to ensure that the incentives would not burden or impede access to the medications patients rely on. And I do not believe that the proposal before us today meets this careful balance. I do, however, recognize that many members on both sides of the aisle feel that some exclusivity should be awarded to incentivize manufacturers to innovate and allow for the manufacturer to recover the cost of development. Therefore, I would urge my colleagues to support this amendment, which would offer over-the-counter drugs 12 months of exclusivity from the time the manufacturer begins commercially marketing the product. I believe this time period would give industry the head start they have asked for from private label competition and provide time for the manufacturer to begin recoup the cost of their development. It also ensures that patient access to innovative over-the-counter drugs will not be unnecessarily delayed. So I would urge my colleagues to vote in support of the amendment, and if after further discussion, would ask for a roll call on this, Mr. Chairman.
Gentleman yield back?
Yes.
Gentleman yields back. Now it's time. Chair recognizes the gentleman from Ohio, Mr. Latta, to speak on the amendment for 5 minutes.
Thank you very much, Mr. Chairman. I move to speak in opposition to the amendment. And, pardon me, it's always been pointed out by several members of the committee that there's been bipartisan work done on this legislation, that we worked the compromise out to change that time frame from 24 to 18 months. And I'd also like to point out that just this past April, the Senate Health, Education, Labor, and Pensions Committee, by a vote of 22-1, reported out S-2315 out of that committee that includes language for 24 months from the effective date. And I think it's important to point that out, that we have been working in this committee in a bipartisan way, and I believe that 18 months is a good date. And I think it's also important to point out that proper incentive is important for innovation, since most product launches fail and it takes a year or more to develop awareness and acceptance. That new launch needs that corner of the shelf to get started. And I think, Mr. Chairman, that's very important that, as I said, with that agreement that we've had, moving from 24 to 18, and I, again, ask a defeat of that motion, and I yield back.
Will the gentleman yield?
I yield to the chairman.
And I just want to add to what Chairman Latta just has pointed out. The bill as is before us today without the amendment is the product of significant compromise, significant work, part of the members and part of the staff. It is a good compromise. Reducing the period of exclusivity down to 12 months, I think, would jeopardize a good product. I see no need for the amendment, and I would encourage a no vote.
Gentleman yields back. Other members seeking recognition. Chair recognizes Gentlelady from Illinois for 5 minutes to strike the last word on the amendment.
Thank you. I just want to go on record as opposing the 18-month exclusivity. In our subcommittee markup, I offered an amendment that would provide no exclusivity for over-the-counter drugs. In my view, all that exclusivity does is weaken competition and raise prices for consumers. Americans rely on affordable over-the-counter drugs. They account for 60% of our medicines on the market, and whether they are treatments for cold symptoms, headaches, stomach ailments, affordable and accessible over-the-counter drugs are essential for the health of Americans. The average U.S. consumer makes 26 trips per year to purchase over-the-counter drug products, and the average household spends $338 per year on these products. In the underlying bill, a drug company could get 18 months of exclusivity for another over-the-counter drug that is no better than an older medicine, all by introducing a new delivery formulation. This could mean taking a tablet and making it into a gummy or a dissolvable strip and then shooting up the price. Drug companies could then stop selling their older over-the-counter version and only sell the higher-priced exclusive version. There would be no opportunity for a generic to enter the market for this new delivery formulation for 18 months. Some claim that drug makers would only raise prices a few dollars for these new products, but given exclusivity, there is no way to ensure that prices would be kept low. And even if that were true, it may not sound like a lot, but for the over 25 million American seniors who are economically insecure, a few dollars might mean the difference between getting the pain relief that works for them or going without. More and more prescription drugs are switching to over-the-counter at the end of their prescription exclusivity. We can't let the over-the-counter process be another way for drug companies to game the system. This long 18-month exclusivity period is a handout to pharmaceutical companies. Extensive exclusivity periods have skyrocketed prescription drug prices, and it is foolish to allow these monopolies to multiply in the over-the-counter market sector. If we truly want to help Americans with more access to medicines, we should focus on lowering prescription drug prices and consider my bill. I have legislation improving access to Affordable Prescription Drug Act that would allow Medicare to negotiate for lower drug prices in Part D, allow for importation of safe prescription drugs, and reduce monopolies for brand name drugs, and help generic competition come into marketplace.
Time's
I yield back.
expired. Any other member seeking recognition? If not, the vote now arises on the Pallone Amendment. Those in favor will vote aye, those no, and the clerk will call the roll.
Mr. Barton. Mr. Barton votes no. Mr. Upton. Mr. Upton votes no. Mr. Shimkus. Mr. Shimkus votes no. Mr. Burgess. Mr. Burgess votes no. Mrs. Blackburn. Mrs. Blackburn votes no. Mr. Scalise. Mr. Latta. Mr. Latta votes no. Mrs. McMorris-Rogers. Mrs. McMorris-Rogers votes no. Mr. Harper. Mr. Harper votes no. Mr. Lance. Mr. Lance votes no. Mr. Guthrie. Mr. Guthrie votes no. Mr. Olson. Mr. Olson votes no. Mr. McKinley. Mr. McKinley votes no. Mr. Kinzinger. Mr. Kinzinger votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Johnson. Mr. Johnson votes no. Mr. Long. Mr. Long votes no. Mr. Bouchon. Mr. Bouchon votes no. Mr. Flores. Mr. Flores votes no. Mrs. Brooks. Mrs. Brooks votes no. Mr. Mullen. Mr. Mullen votes no. Mr. Hudson. Mr. Collins. Mr. Collins votes no. Mr. Kramer. Mr. Kramer votes no. Mr. Wahlberg. Mr. Wahlberg votes no. Mrs. Walters. Mrs. Walters votes no. Mr. Costello. Mr. Costello votes no. Mr. Carter. Mr. Carter votes no. Mr. Duncan. Mr. Duncan votes no. Mr. Pallone. Mr. Pallone votes aye. Mr. Rush. Mr. Rush votes aye. Ms. Eshue. Ms. Eshue votes aye. Mr. Engel. Mr. Engel votes aye. Mr. Green. Mr. Green votes aye. Ms. DeGette. Ms. DeGette votes aye. Mr. Doyle. Mr. Doyle votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Mr. Butterfield. Mr. Butterfield votes aye. Ms. Matsui. Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Sarbanes. Mr. Sarbanes votes aye. Mr. McNerney. Mr. McNerney votes aye. Mr. Welch. Mr. Welch votes aye. Mr. Lujan. Mr. Lujan votes aye. Mr. Tonko.
Aye.
Mr. Tonko votes aye. Ms. Clark. Ms. Clark votes aye. Mr. Loebsack. Mr. Loebsack votes aye. Mr. Schrader. Mr. Schrader votes aye. Mr. Kennedy. Mr. Kennedy votes aye. Mr. Cardenas. Mr. Cardenas votes aye. Mr. Ruiz. Mr. Ruiz votes aye. Mr. Peters. Ms. Stingle. Ms. Stingle votes aye. Mr. Hudson. Oh, sorry. Mr. Hudson votes no. Mr. Peters. Mr. Peters votes aye. Chairman Walden.
I'd like to vote no.
Chairman Walden votes no.
Thank you. Are there other members who have not been recorded? Other members who have not been recorded? Who's on your list there that hasn't been recorded?
Mr. Scalise.
Mr. Scalise is not here. Anyone else? Is Mr. Peters recorded? He is, okay. All right, clerk will report the result.
Mr. Chairman, on that vote, there were 30 noes and 24 ayes.
30 noes, 24 ayes. The amendment is not adopted. Are there any other amendments to this legislation? Are there any other members wishing to speak on this bipartisan legislation? If not, the question now occurs on favorably reporting H.R. 5333 as amended, right, to the House. All those in favor shall signify by saying aye. Aye. Those opposed, nay. The ayes have it, and the bill is favorably reported. The chair calls up H.R. 5473. This is number 31 on the list, and asks the clerk to report.
H.R. 5473, to direct the Secretary of Health and Human Services to update or issue one or more guidances addressing alternative methods for data collection on opioid sparing and inclusion of such data in product labeling and for other purposes.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to this bill? Are there any amendments to this bill? Does anyone wish to strike the last word on this bill? Dr. Burgess, recognized for 5 minutes.
Thank you, Mr. Chairman, and I appreciate your recognition for striking the last word. And I do want to speak in favor of this bill, and I want to commend the authors, Representative Comstock and Representative Lujan, for their bipartisan work on this policy. This bill would take steps to facilitate the development of products that reduce, replace, or prevent the use of opioids. Specifically, this legislation will direct the Food and Drug Administration to hold a public meeting and update the agency's guidance on opioid-sparing data that can be used to support updated product labeling and claims. For many Americans dealing with chronic or acute pain, there are limited alternatives, but for some patients, there may be therapeutic alternatives which do not share the same risks inherent in the use of an opiate. This bill will facilitate the process of getting information to providers and patients at a critical juncture in their treatment. By reducing the need to start an opiate, we can stop addiction before it starts and save lives in the process. I again want to commend Representative Comstock and Representative Lujan for working on this, and I urge members of the committee to vote in favor of this narrowly tailored, common sense, non-controversial measure. Yield back.
And the gentleman yields back. Any other member seeking recognition? Chair recognizes the gentleman from New Mexico, Mr. Lujan, for 5 minutes to strike the last word. I don't believe your microphone's on. We want to hear what you have to say.
Thank you, Mr. Chairman. I appreciate that. We must work with our FDA partners and with our pharmaceutical researchers and developers to make sure that patients across the country have non-addictive pain management options. I come from a blue-collar district with iron workers and ranchers, and a whole lot of people where wear and tear on their bodies is inevitable. It's simply unrealistic to think that we won't have people who need access to pain management options. That's where non-addictive therapies come in. This bill is another step forward in making sure that everyone has more options to treat pain. Well, we're talking about non-addictive pain medications and how important they are to break the cycle of addiction back home. I want to take a second to direct my comments towards all of the pharmaceutical manufacturers who are developing or plan to develop drugs in this space. This is important. We all need these innovative technologies, and we all are grateful for your investment in these drugs. That being said, I'm already starting to be concerned regarding the cost of these drugs. I'm worried that families struggling to make ends meet will be left struggling with addiction to opioids. People that need these treatments should not be turned away. That's why all non-addictive pain medications must be affordable, accessible, and high quality. I look forward to working with stakeholders on these issues and appreciate the committee for passing my bill, which will help get non-opioids to market sooner and with better data. And with that, Mr. Chairman, I yield back.
Gentleman yields back. Other members seeking recognition on this legislation? Seeing none. The question now occurs on favorably reporting H.R. 5473 to the House. All those in favor will signify by saying aye. Aye. Those opposed, nay. The ayes have it, and H.R. 5473 is favorably reported to the House. Chair now calls up H.R. 5554, so this would be number 32, as forwarded by the Subcommittee on Health on April 25, 2018. The clerk asks the clerk to report.
H.R. 5554, to amend the Federal Food, Drug, and Cosmetic Act to reauthorize user fee programs relating to new animal drugs and generic new animal drugs.
Without objection, the first reading of this bill is dispensed with, and the bill will be open for amendment at any point. Are there any bipartisan amendments to this bill? Mr. Hudson is recognized. For what purpose?
Thank you, Mr. Chairman. I have an amendment.
The clerk will report the amendment.
Amendment to H.R. 5554, offered by Mr. Hudson.
Without objection, further reading of the amendment is dispensed with. The chair recognizes the gentleman from North Carolina, Mr. Hudson, to speak on his amendment for 5 minutes.
Thank you, Mr. Chairman. First, I'd like to speak in favor of the underlying bill and thank my colleagues, Representative Mark Wayne Mullen and Representative Kurt Schrader, for their leadership on this bill. The reauthorization of these user fees is critical to the timely approval of animal drugs, and I applaud their work to put together a great bill. Further, I'd like to offer a bipartisan amendment with Representative Schrader, Bouchon, Butterfield, Mullen, and Pallone to expand conditional approval to include major uses, major species. Right now, there are numerous unmet medical needs in veterinary medicine due to the complexity of providing clinical efficacy. We need to give drug developers the tools they need to deliver these drugs to pet owners, farmers, and veterinarians who need them to save their animals. Also, I'd like to yield, I'd like to ask Mr. Chairman if I could submit letters to the record, come from 29 different organizations that support this expanded conditional approval.
Without objection, so ordered.
Thank you, Mr. Chairman. And with that, I'd like to yield the balance of my time to my good friend from North Carolina, Mr. Butterfield.
Gentleman from North Carolina is recognized. I don't know, is Mr. Butterfield here? Not at the moment, Mr. Hudson, so.
Well, if no one else that's one of the co-sponsors would like to speak, I would.
The gentleman yield.
Yes, I would be happy to yield.
Are you to Mr. Green?
Mr. Green, yes, Mr. Chairman.
Thank you. I'm going to speak in support of both H.R. 5554 and this amendment. The animal drug and animal generic drug user fee amendments of 2018. I'm proud to be a co-sponsor of this legislation that would reauthorize ADUFA and AgDUFA programs. This bill represents an extensive negotiation between the FDA and the animal health industry. It's necessary to reauthorize ADUFA and AgDUFA to ensure that there's no lapse in resources for the FDA to approve animal drugs in a timely manner. ADUFA and AgDUFA help FDA to streamline the approval process for animal drug applications in order for innovative and life-saving drugs to reach the market in a more predictable timeline. We want our pets to have the best treatment options available, and we want our food-producing animals to be as healthy as possible. ADUFA and AgDUFA further both these goals. This legislation passed by the Health Subcommittee by voice vote 2 weeks ago with strong bipartisan support. I support the amendment expansion of conditional approval to medications for major species and major uses. And I urge my colleagues to support this amendment and the bill. And thank my colleague for yielding to me.
Reclaiming my time. If there are any other co-sponsors who would like to speak in favor, I'd be happy to yield.
Yeah. Mr. Schrader, you want your own time, Mr. Schrader? Okay. Oh, Mr. Butterfield is here. Mr. Butterfield, I think Mr. Hudson would like to yield the remainder of his time to you as a colleague from North Carolina as you get settled in there.
Thank you, Mr. Chairman. I'm here with my banana. I went back to the office to get it. Didn't realize this would go so quickly, but thank you, Mr. Chairman. Thank you for marking up this important Animal Drug User Fee Act and the Animal Generic Drug User Fee Act legislation. These fee agreements are important to millions of North Carolinians living with companion animals. They are also important to the agricultural community. Some of you may not be aware that North Carolina is the second largest pork producer in the country, the second largest turkey producer, and the third largest poultry producer in the country. Our agriculture community and family farms are essential to feeding our nation. They depend on medicines to keep animals healthy. And so I rise in support of an amendment that I've worked on with my friend Mr. Hudson to allow for expanded authority for conditional approval of medicines for animals. Under current law, the FDA already has some authority to allow some medicines for animals to receive conditional approval. This amendment reflects agreement between the FDA and industry on improving the pathway for animal medicine while still ensuring safety requirements. This amendment, Mr. Chairman, also includes protections to address concerns with antibiotics. And so I urge my colleagues to support it. And I thank you, Mr. Hudson, and I yield back.
Gentleman yields back. Mr. Hudson.
Mr. Chairman, I yield back.
Gentleman yields back. Are there other members seeking recognition? Chair recognizes the gentleman from New Jersey, Mr. Pallone, for 5 minutes. Strike the last word.
Thank you, Mr. Chairman. And I am speaking in support of the amendment offered by Mr. Hudson and Mr. Butterfield, and also thank them for incorporating my amendment as well. As I noted during the subcommittee markup 2 weeks ago, I have both procedural and policy concerns regarding expanding conditional approval for new animal drugs in certain cases for major uses and major species. However, at this time, many of those concerns have been addressed through the amendment we're considering. Currently, FDA has the authority to conditionally approve certain new animal drugs for minor uses or minor species for up to 5 years while manufacturers continue to demonstrate effectiveness. This amendment would expand this conditional approval pathway to major uses or for major species given certain criteria. This represents a significant policy change in FDA's review and approval of new animal drugs, and I strongly believe that this policy must have guardrails in place to ensure FDA can effectively implement these changes while continuing to protect companion and food-producing animals. And for this reason, I'm pleased that the amendment provides specific dates by which FDA must issue guidance on the parameters for utilizing conditional approval for major uses and major species. Additionally, I remain very concerned about the threat of antibiotic resistance and the use of antibiotics in food-producing animals. And therefore, I'm pleased that this amendment language excludes antimicrobials from the expanding conditional approval pathway. I share the view of my colleagues that our companion animals and food-producing animals are best served when they can access new and innovative treatments to protect their health and to protect human health as well. I appreciate that we've been able to reach consensus on a bipartisan basis to move forward this amendment, as well as my amendment concerning veterinary oversight for certain antimicrobials. The public health crisis resulting from antimicrobial resistance has received bipartisan concern and interest. According to the CDC, each year in the United States, at least 2 million people become infected with bacteria that are antibiotic resistant, and at least 23,000 people die each year as a result of these infections. Further, there's some evidence that some antibiotic resistance in bacteria is caused by antibiotic use in food animals raised for human consumption. To that end, FDA has taken steps to increase oversight and transparency related to the use of antimicrobials in food-producing animals. FDA first published guidance in 2013 to bring the use of medically important antimicrobials in food-producing animals under veterinary oversight in order to limit or reverse resistance that has resulted from the overuse of antibiotics in animals. And since January of last year, all medically important antimicrobials used in feed or water for food animals are now under veterinary oversight. While antimicrobials administered in feed and water represent the majority of antibiotics sold and distributed for food animals, one gap in such oversight is medically important antibiotics administered in other dosage forms, such as injectables or tablets. The amendment offered by Mr. Hudson and Mr. Butterfield incorporates language that is consistent with this recommendation by GAO and would require FDA to submit a report to Congress by the end of fiscal year 2019 regarding how the agency intends to bring all medically important antimicrobial drugs intended for use in animals under veterinary oversight, including having them labeled to require that their use by under the professional supervision of licensed veterinarians. And this will build off of the work FDA has already done to encourage the judicious use of medically important antimicrobials and will ensure critical oversight in their use in animals. So I look forward to moving the underlying legislation to the floor promptly and yield back, Mr. Chairman.
Gentleman yields back. Other members seeking recognition on this legislation. Gentleman from Oregon, Mr. Schrader. Dr. Schrader is
Thank you, Mr.
recognized,
Chairman.
our resident veterinarian.
Appreciate that, particularly as a veterinarian, to see this bipartisan legislation come to the floor, and particularly this amendment. Really commend Mr. Hudson working with his team and Barnyard Group and Companion Animal Group, veterinarians, overtime to make sure we could get this to the floor in the best possible manner. And I think it's a good thing. It's a good thing. This will expand the conditional approval for animal drugs or major uses and major species. It holds the potential to expand a lot of opportunities for drugs to meet very specific requirements to fill unmet medical needs in the veterinary world. As a veterinarian, I'm acutely aware of a lot of the great innovations that occur in the human pharmaceutical world that are unavailable for long periods of time to veterinarians. And the animals, they just don't have the bandwidth to engage the pharmaceutical industry to develop these drugs. So the conditional use process is critical to gain access to these things under very specific criteria to make sure our four-footed friends have some of the greatest and latest innovations that our human folks do. And I'd emphasize that under this conditional use process, there has to be a reasonable expectation of effectiveness. The design has to be very difficult for a pharmaceutical firm to develop. It still have to have good studies, have efficacy, and make sure that there's effectiveness over this 5-year span. And I'd emphasize there's a 5-year span by which this drug has got to be made available through all the processes that FDA has, or it goes away. So it's a very tight process. The goal here is just to make sure that folks have an opportunity in the veterinary world and in the animal industry world to have access to some of these great drugs. Both the DUFA and AgDUFA build a unique and safe process for innovation for new animal pharmaceuticals. This conditional use expands that in a very appropriate way, very careful way. I think all this is great for the veterinary community, the companion animal community, livestock owners and producers, and of course animals themselves. Not sure I agree with our ranking member, who I really appreciate working with on this with regard to the antimicrobial concerns, at least to the degree, but I think it's very good idea to bring antimicrobial administration under veterinary supervision in one form or another. I do concur with that. So again, thank everybody for all their extremely hard work. I'd also urge support for the underlying bill, H.R. 5554, sponsored by myself and Representative McMullen. He brings invaluable livestock expertise to the legislation. I just wanted to emphasize that based on our subcommittee hearings to make sure that was clarified. So I thank you, and I yield back the balance of my time.
Gentleman yields back the balance of his time, and for those who want to see how AgDUFA, what it means to animals, I would direct your attention to Ted Walks AgDUFA. If you just Google that, you'll find a little video our team put together with our new office dog. And Ted walks us through how this is. He knows dog, he doesn't know English yet. So it's a Ted Walks, not a Ted Talks. But anyway, if you want to learn. You know, we're just trying to help communicate how a bill becomes law. Ted Walks AgDUFA. Ted Walks AgDUFA. Go there now. Be the first on your neighborhood. Are there other members seeking recognition? Mr. Mullen is recognized for 5 minutes to speak on legislation.
Thank you, Mr. Chairman, and I'd like to thank our only veterinarian on the committee, Mr. Schroeder, for his valuable input into the bill. And I do agree with his statement about the antibiotics. And as a rancher, someone who has a lot of cattle at home, the difficulties that it causes, but at the same time, DUFA is very important, and it's wonderful to see us working in a bipartisan bill. I'd like to point out I've never seen a perfect bill come out of Congress, but it's part of negotiating. And when we can come together on a bipartisan approach, something that the industry has been doing for quite a while now, it shows that we can still work together. So thank you for everybody that's worked on this bill, and thank you for my colleague from North Carolina, Mr. Hudson, for the amendment and making it stronger and being able to work with us. I do encourage everybody to support this amendment and the underlying bill. With that, Mr. Chairman, I yield back.
Gentleman yields back. Are there other members seeking to speak on the amendment? If not, the question now arises on the Hudson Amendment. Those in favor will say aye. Those opposed, no. The ayes appear to have it. The ayes have it. The amendment's adopted. Are there any other amendments? See none. No one else seeking. Oh, I'm sorry. Gentlelady from Illinois, for what purpose do you seek recognition?
Thank you, Mr. Chairman. I offer this amendment with the intent to...
Let's call it up.
Oh, I'm sorry. I have an amendment at the desk.
Thank you. Clerk will report the amendment.
Amendment to H.R. 5554, offered by Ms. Schakowsky.
Mr. Chairman?
Yeah.
I'd like to reserve a point of order against this amendment.
Mr. Barton reserves a point of order against the amendment. Gentlelady from Illinois is recognized for 5 minutes to speak on her amendment.
Thank you, Mr. Chairman. I offer this amendment with the intent to withdraw it, but it would direct the Food and Drug Administration to work with those making animal drugs on how we could implement duration limits on the use of medically important antimicrobial agents. The development of antimicrobial agents is one of the most successful medical developments. Before them, a paper cut could kill. I do want to thank the bipartisan work of this committee and thank particularly Mr. Pallone, Mr. Schrader, Mr. Butterfield, Mr. Hudson, Mr. Mullen, and the majority who worked on a package exempting medically important antimicrobials for major food-producing animals from conditional approval. This is a great first step, but I think we need to do more to address antimicrobial resistance. As we have seen in increased use and misuse, especially of antibiotics, the bacteria have evolved to be resistant. This means more and more bacteria cannot be killed with traditional antibiotics, making antibiotics less effective. I wanted to say this on behalf of my friend, the late, unfortunately, the late Representative Louise Slaughter, who was a champion on this issue for many decades. And she stated, quote, "Antibiotic resistance threatens modern medicine. The scale and potential harm to public health from this crisis are almost unimaginable," unquote. More than 80% of the antibiotics used in this country are used on healthy farm animals. So what my legislation would do to help safeguard the antimicrobials that we have and protect against its overuse in food production. So all this amendment does, as I said, which I will withdraw, but would have a study, have the FDA work with those that already make those animal drugs to see if we could implement duration limits, saying how long you could use the particular drugs, which we know are medically important. So I will withdraw my amendment.
The gentlelady withdraws her amendment. Are there other members seeking recognition on this legislation? If not, then the question arises to favorably report H.R. 5554 as amended to the House. All those in favor will signify by saying aye. Aye. Those opposed, no. The ayes have it, and the bill is favorably reported. Chair now calls up H.R. 5687. This would be 33, number 33 on your list, and asks the clerk to report.
H.R. 5687, to amend the Federal Food, Drug, and Cosmetic Act to require improved packaging and disposal methods with respect to certain drugs and for other purposes.
Without objection, first reading, the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to this bill? Are there any amendments to this bill? Are there any members wishing to speak on this bill?
Mr. Chairman.
Who's seeking? Gentleman from North Carolina is recognized for 5 minutes to speak on the bill.
Thank you, Mr. Chairman. A city right in my backyard, Fayetteville, North Carolina, is one of the worst cities for abuse of opioids in the country. This issue has affected friends, family, neighbors, and entire communities. I applaud the committee for taking this initiative, and I believe this bill that I've worked on with my good friend and colleague, Mr. Butterfield, the Sound Disposal and Packaging Act, will help curb the excess opioids in our communities. I'd like to thank Mr. Butterfield for working with me on this important issue. And Mr. Chairman, without objection, I'd like to submit a letter from Dispose RX, a company in my district that makes a product that helps us dispose of opioids safely.
Without objection.
And with that, Mr. Chairman, I would just urge my colleagues to support this legislation, and I yield back.
Gentleman yields back. Chair recognizes the gentleman from New Jersey for 5 minutes to speak on the bill.
Mr. Chairman, I also want to speak in support of the bill. One of the overarching goals of this legislation is to leverage packaging and disposal technologies and controls to mitigate the risk of abuse and misuse by reducing the number of unused opioids that may be diverted, with the idea that fewer individuals become addicted to these drugs to begin with. And this goal would be accomplished by providing FDA with the authority to require packaging and disposal technologies for Schedule II and III controlled substances that reflect the risk of these substances. FDA has been actively exploring the potential of these technologies and recently held a public workshop on the issue last winter. More recently, FDA directed manufacturers of Loperamide to make changes to their packaging to allow for single-dose limits that would help to reduce the number of doses that could be abused. Commissioner Gottlieb has noted that the use of technologies such as packaging merits consideration through a careful science-based process, and one that I hope will continue. The legislation builds on his work and allows FDA the flexibility to permit a range of options for packaging or disposal, as long as such technologies demonstrate comparable effectiveness. And this flexibility would be critical to reduce barriers to generic entry, one of the concerns I have had about this legislation, and to maintain appropriate patient access to these substances. The bill also clarifies that labeling related to the inclusion of packaging or disposal cannot be used as a blocking strategy by brand manufacturers. So I want to thank the FDA, Representatives Hudson and Butterfield, for addressing the concerns that have been raised related to generic entry. The purpose of these changes has been to ensure that if there is a decision made by FDA to require the use of packaging, that brand and generic manufacturers have to meet the same performance outcome, but are also afforded enough flexibility to pursue the technology they believe are best suited for their products. I still have some concerns that the cost of packaging or disposal could be passed down the supply chain to the patient, but I'm hopeful that the flexibility built into this bill will enable manufacturers to pursue cost-effective solutions that meet the safety goals shared by FDA and the stakeholders. So again, thanks to Congressman Hudson and Butterfield, and appreciate your consideration of my concerns, and I support the bill. I yield back, Mr. Chairman.
Thank the gentleman, and he yields back. Other members seeking recognition on this legislation? Seeing none. Question now arises on favorably reporting H.R. 5687 to the House. All those in favor shall signify by saying aye. 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 Those opposed, no. The ayes have it. The bill is favorably reported. The chair calls up H.R. 4275. This would be number 6 on your list, as forwarded by the Subcommittee on Health on April 25th, 2018, and asks the clerk to report.
H.R. 4275, to provide for the development and dissemination of programs and materials for training pharmacists, healthcare providers, and patients on indicators that a prescription is fraudulent, forged, or otherwise indicative of abuse or diversion, and for other purposes.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any time. Are there any bipartisan amendments? Are there any amendments? Seeing none, does anyone want to strike the last word on this bill?
Mr. Chairman.
Mr. Carter.
Move to strike the last word.
You're recognized for 5 minutes.
Thank you, Mr. Chairman. I urge swift passage of this legislation. The committee print before us today incorporates a simple amendment that was adopted by voice vote in subcommittee. The straightforward amendment changed the origination of the prescriber materials to the Secretary of HHS in consultation with the administrator of the DEA. A previous version of this bill originated the materials through the administrator of DEA in consultation with the Secretary of HHS. As a pharmacist and a member of the Health Subcommittee, I believe that this is more appropriate given that the Secretary oversees the nation's health department. While law enforcement plays a key role in detecting and stopping fraudulent prescriptions, the responsibility ultimately lies with pharmacists who are licensed healthcare professionals. As I previously said, this bill will complement the DEA's current efforts, like the Diversion Control Division's Pharmacy Diversion Awareness Conferences held throughout the country, as well as their other meetings, presentations, and seminars. I encourage all members to favorably report this bill to the full House of Representatives for floor consideration, and I yield back.
Gentleman yields back the balance of his time. Other members seeking recognition? Seeing none. Question now occurs on favorably reporting H.R. 4275 as amended to the House. All those in favor shall signify by saying aye. 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 Those opposed, nay. The ayes have it. The measure is favorably reported. Chair calls up H.R. 5041. This will be number 7, as forwarded by the Subcommittee on Health on April 25th, 2018, and asks the clerk to report.
H.R. 5041, to amend the Controlled Substances Act to authorize the employees of a hospice program to handle controlled substances in the residence of a deceased hospice patient to assist in disposal.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments? For what purpose, gentlemen from Michigan seek recognition?
Mr. Chairman, I'd like to discuss the amendment.
Do you have an amendment at the desk? The clerk will report the amendment.
Amendment to H.R. 5041, offered by Mr. Wahlberg.
Without objection, further reading of the amendment is dispensed with, and the gentleman from Michigan is recognized for 5 minutes to speak on his amendment.
Thank you, Mr. Chairman. Before I discuss the amendment, I would first like to speak generally on H.R. 5041, the Safe Disposal of Unused Medication Act, bipartisan legislation that I introduced with my good friend and colleague, Representative Debbie Dingell and Representative Richard Hudson. This is a common sense bill that will reduce the number of unused controlled substances at risk of misuse by simply allowing hospice workers to safely dispose of medications in a patient's home after the patient has passed away. In my home state of Michigan, we have seen real challenges with the diversion and misuse of leftover medications that have contributed to the opioid crisis. During the committee's hearing, we heard from Dr. John Mulder with Trillium Institute in Grand Rapids, Michigan, testifying that because of current DEA regulations, hospice workers across the country are potentially leaving huge quantities of unused medication in a home after a patient's death. Hospices and hospice personnel could play a key role in helping ensure these drugs are disposed in a responsible manner and not diverted for unintended purposes. H.R. 5041 simply allows the hospice employees who have the appropriate licensing and training to responsibly dispose of unused medications after a patient has passed away. We know that tragically many people begin the cycle of addiction through the misuse of prescription medication. H.R. 5041 is a common sense and simple step that can get many unused pills that are at risk of misuse and diversion off the streets. In regards to the amendment, I first like to thank Ranking Member Pallone for offering an amendment to this legislation during the Health Subcommittee markup. The amendment, adopted by voice vote in subcommittee, clarified that the training will be conducted by the hospice program, not the federal government. It also added a record-keeping standard for hospice programs to maintain information within patients' clinical charts of the controlled substance, dosage, number of pills, and the way it's disposed. The amendment before us today is a bipartisan amendment and incorporates technical comments from the DEA. I consider these to be technical in nature and urge the committee to adopt their recommendations. Of note, there is a change to the employee definition. Both the National Association for Home Care and Hospice, as well as the National Hospice and Palliative Care Organization, have reviewed and approved the DEA's recommendation. Again, this amendment is technical in nature, and I urge support for both the amendment as well as the underlying bill. And, Mr. Chairman, I yield back.
Gentleman yields back. Other members seeking recognition on the Wahlberg amendment? Gentlelady from Michigan is recognized for 5 minutes to speak on the amendment.
Thank you, Mr. Chairman. Move to strike the last word.
Gentlelady is recognized.
Thank you. I'm just going to first tell you what an honor it's been to work with my colleague, Mr. Wahlberg, in addressing this issue. And this is just, as he said, it's a simple fix. Hospice does really important work. And I have to tell you, more and more when I'm out there, I'm hearing from people who are really scared that they're not going to have what they need as they are dying. We need to make sure they have the medicine, but then we need to make sure that there's a responsible way to dispose of it. That's what this bill does. It's simple and it's commonplace. Mr. Wahlberg gave all the other reasons why we should be supporting it, so I urge my colleagues to support this as another step in public policy trying to get at this issue. And with that, I yield back the balance of my time.
Yields back. Other members seeking recognition on the Wahlberg amendment? Seeing none, the question now arises on passage of the Wahlberg amendment. All those in favor will say aye. Aye. Those opposed, nay. The ayes appear to have it. The ayes have it. The amendment's adopted. Are there other members seeking recognition on the bill? If not, then the question arises on approving the legislation as amendment and favorably reporting it to the House, H.R. 5041. All those in favor will signify by saying aye. Aye. Those opposed, nay. The ayes appear to have it. The ayes have it. The bill as amended is reported favorably to the House. The The chair now calls up H.R. 5202, that'll be number 8 on your list, and asks the clerk to report.
H.R. 5202, to amend the Controlled Substances Act to provide for the delivery of a controlled substance by a pharmacy to an administering practitioner.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments? Are there any amendments? The chair recognizes the gentleman from Vermont. For what purpose?
I have an amendment at the desk.
The clerk will report Mr. Welch's amendment.
Amendment to H.R. 5202, offered by Mr. Welch.
Mr. Chairman,
For what purpose, gentleman from Texas seek recognition?
I reserve a point of order against the
Gentleman reserves a point of order against the amendment. Chair now recognizes the gentleman from Vermont to speak on his amendment for 5 minutes.
Thank you, Mr. Chairman. A little background. One of the tools that the Drug Enforcement Administration has in order to try to keep illicit opioids off the market is a provision for an immediate suspension order. This committee took up legislation ensuring patient access and effective Drug Enforcement Act, and a provision that was included in that as it passed this committee was a standard that would say that in order for the DEA to act on that, it would establish foreseeable risk. Prior to that, there really was no standard. It was creating confusion for legitimate activities of drug distributors like Burlington Drug, which is a family business in Vermont, and also creating legal uncertainty. This committee considered the bill that was offered by Mrs. Blackburn, Congresswoman Blackburn, and me. It passed it unanimously, where it then went to the Senate. And with Senator Hatch and members of the Senate and the DEA engagement, the standard was changed there to what was called substantial likelihood as the triggering event. The bill was passed unanimously with the input of the DEA, signed by President Obama. Subsequent to that, questions were raised as to whether whatever the intent was of Congress to provide clarification, it was actually inhibiting the Drug Enforcement Administration from pursuing the immediate suspension order definition. After that, you may remember, Mr. Chairman, we had a hearing at which you invited the DEA and they testified, and we asked them very specifically, what standard do you need that will help you be most effective in doing your work? And Mr. Chairman, you sent a letter to the DEA asking them for an answer to that question. That was on October 27, 2017. And on February 28, 2018, the DEA responded by letter to you, which I'd like to make part of the record.
Absolutely, without objection.
And in that, with the Justice, or through the Justice Department, they said that the substantial likelihood standard they recommended be amended to a probable cause standard. Pardon me. And just yesterday in the House Judiciary Committee, the acting administrator of the DEA was asked that question again. And I just, if I can, want to quote his response. So foreseeable is certainly a lower standard than probable cause. And as I've discussed with you and others, I appreciate the ability to get to that level as low as possible. But the reason why we have picked the DEA probable cause is it is well-defined, essentially standard for our agency. As we looked at all of these issues, we found that we could meet probable cause every time. So I appreciate your effort to go to foreseeable. At the same time, I think that using probable cause strikes a balance between the industry and understanding where that is. My amendment would incorporate the recommendation of the DEA to amend the Ensuring Patient Access and Effective Drug Enforcement Act to the probable cause standard recommended by the DEA in its letter to you, Mr. Chairman, and through its testimony in the House Judiciary Committee yesterday. And I yield back.
Gentleman yields back. Chair recognizes the gentleman from Texas.
Mr. Chairman, I've listened closely to the author's explanation of his amendment. I'm not an attorney, and I understand this is a complex issue, but under the rules of the House, it is not germane under Clause 7 of Rule 16. And so with reluctance, I would insist on my point of order.
Would the gentleman yield to me?
Always.
I appreciate the gentleman and respecting the rules of the House. I also been in conversation with Mr. Welch. We share a concern about this. I could go through a list of things. And I appreciate your hard work on this issue and look forward to working with you in the future and other members of this committee to address this issue. It did take, seems to me, more than a year for the DEA to respond. They've been reluctant. It's been an issue. Our staffs are now in communication with the DEA. We still await the report through HHS on this whole matter. And so despite the fact this is out of order today, and not germane, we will continue to work to resolve this once and for all and get it right.
May I inquire?
And would you be willing to withdraw your amendment?
Well, if there's a point of order, I accept the ruling of the chair on the point of order.
Well, we haven't taken a vote on that. We can.
It's your,
if you want,
you
or you
get
can
to make the decision.
If you want to withdraw it, you can do that, or we can proceed on the point of order on the germaneness issue.
Mr. Chairman.
Well, I won't be calling for a vote on the point of order.
Okay.
If I can, I know we have a common desire here, but I think we really do want to get clarification in legal finality to what that standard is, and rather than have it be in limbo. So, Mr. Chairman, I don't know whether you could give us some assurance as to when we might have a hearing, get the DEA back in here, and then get very concrete and specific about what this standard is.
Yeah. I can't give you a date specific sitting here right now, but I do commit to working with you and others on the committee to resolve this once and for all in a way that works for the DEA and the safety of patients in our communities. It is Mr. Barton's time. You insist on the point of order?
I do insist.
Gentleman insists on the point of order, and having reviewed the amendment and listened to the arguments, the chair finds the amendment does violate the subject matter provisions in respect to the underlying bill. Therefore, the chair sustains the point of order. Is there further discussion on the bill? Chair,
just real quick, I want to...
Further discussions on the bill. The chair recognizes the gentleman from Pennsylvania to strike the last word.
On the amendment?
The amendment's gone.
It's gone, okay.
But you can...
So I won't be applauding Mr. Welch for his amendment, even though I agree with it, although I do find Mr. Barton's point of order to be correct in the fact that it wasn't germane. Are we going now to the Amendment 5202? No, excuse me.
We're on the bill.
HR 5202.
Yeah, if you want to speak on that, or I think Mr. Griffith's looking for time if you're planning to yield.
So I'll speak on 5202.
Okay. Yeah, continue on. The time is yours.
Thank you, Mr. Chairman. I appreciate the Health Subcommittee favorably reporting this bill by voice vote, the intent of which is to update federal law to reflect technological advancements in medicine. At times, as we all know, innovation outpaces federal law. During the Health Subcommittee markup, Vice Chairman Guthrie made 3 points explaining the need for this legislation. First, the CSA does not account for the dispensing of injectable or intrathecal drugs. Second, under current law, a pharmacy cannot dispense a practitioner-administered version of buprenorphine, which is the case with new injectable forms of the treatment, since the practitioner is not the end user. And third, what this bill clarifies is that pharmacies can dispense injectable and intrathecal controlled substances to a practitioner who will administer the drug to the patient in need. Following the Health Subcommittee markup, our staffs and industry stakeholders continued bipartisan discussions with CMS and DEA to confirm this language is airtight, and it is my understanding that they have received confirmation that this bill is prepared for floor consideration from a technical perspective. I urge support for this legislation and look forward to House consideration of this proposal.
Is the gentleman going to yield to the gentleman from Virginia, maybe, with the remainder of his time?
That's what I was looking to do.
Yeah.
I thank the gentleman for yielding his time and for him putting in this important legislation. In relationship to Mr. Welch's concern, I think we all share that, but I do have to take exception with the DEA looking at us. We passed legislation that they asked for, that they approved. Then they created a new standard that was the same standard as a reasonable doubt standard before they would issue immediate suspension orders. And that's how we find ourselves in this position. They took a position that I think was legally flawed based on language that they asked us for and then said it's our problem, we need to fix the language. They should have asked for the probable cause standard in the first place. I think we would have gladly given it to them. We've got to figure out how to fix it on an appropriate measure. That being said, I yield back to Mr. Costello of Pennsylvania.
And I will yield back.
Gentleman yields back the balance of his time. Other members seeking recognition on the underlying bill. Seeing none and no other amendments, the question now arises about final passage of H.R. 5202. Those in favor will say aye. Those opposed, nay. The ayes appear to have it. The ayes have it, and the measure is reported to the House favorably. The chair now calls up H.R. 5483. That would be number 9 on your list, as forwarded by the Subcommittee on Health on April 25, 2018, and ask the clerk to report.
H.R. 5483, to impose a deadline for the promulgation of interim final regulations in accordance with Section 311H of the Controlled Substances Act, specifying the circumstances in which a special registration may be issued to a practitioner to engage in the practice of telemedicine and for other purposes.
Mr. Costello, I think your microphone is still on. Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to this legislation? Are there any amendments to this legislation? Are there members seeking time? Gentleman from Georgia, Mr. Carter, is recognized for 5 minutes to speak on the legislation.
Thank you, Mr. Chairman. Mr. Chairman, the committee printed under consideration today incorporates an amendment that was adopted by voice vote in subcommittee. I offered the amendment in response to a DEA request to lengthen the time in which they must publish rules for the establishment of the special waiver process. Under a previous version of this bill, the DEA would have had up to 90 days to complete this task. At their request, this committee favorably reported an amendment extending this window to 1 year. Finalizing rules for the special waiver process is on the unified agenda of the Justice Department and DEA, a signal that they understand the need to implement this provision of law. I urge each member to support this practical legislation, and I yield back.
Gentleman yields back balance of his time. Chair recognizes the gentleman from New Jersey, Mr. Plone, for 5 minutes to strike the last word.
Thank you, Mr. Chairman. I support this legislation. One critical component of any response to our opioid crisis must continue to be how we can work to provide those suffering from substance abuse and addiction with access to treatment. Telemedicine offers one opportunity to potentially reach more patients who could not otherwise access treatment, whether it's for geographic reasons, provider access issues, or financial concerns. While DEA has the authority to establish a special registration pathway for purposes of treating a patient via telemedicine, DEA has not initiated rulemaking to date to do so, and the Special Registration for Telemedicine's Clarification Act, authored by Representatives Bustos and Carter, would direct the AG to issue regulations establishing a special registration process for engaging in the practice of telemedicine. This approach will enable telemedicine to finally be deployed in treating patients with addiction while still allowing DEA to ensure that there are appropriate safeguards in place to mitigate against the use of telemedicine in any manner that could further exacerbate the opioid crisis. So I urge my colleagues to support this important bill.
And the gentleman yields back the balance of his time. Any other members seeking recognition? If not, the question now occurs on favorably reporting H.R. 5483 as amended to the H.R. 5483 to the House. All those in favor shall signify by saying aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the bill is reported. Now we'll turn to our energy agenda, and the chair calls up H.R. 4606. This would be number 1 on the list, and ask the clerk to report.
H.R. 4606, to provide that applications under the Natural Gas Act for the importation or exportation of small volumes of natural gas shall be granted without modification or delay.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there bipartisan amendments to the bill? The chair recognizes the gentleman from Ohio for what purpose?
Mr. Chairman, I have a bipartisan
Clerk will
amendment.
report the amendment.
Amendment to H.R. 4606, offered by Mr. Johnson.
Without objection, further reading of the amendment is dispensed with. The chair recognizes the gentleman from Ohio to speak on his amendment for the next 5 minutes.
Mr. Chairman, I'm proud to offer this amendment along with my colleague, Representative Gene Green. While H.R. 4606 has always been bipartisan, this amendment is about furthering that support by ensuring environmental concerns that were raised during the subcommittee markup are addressed, while maintaining the underlying purpose of the bill, and that is to help the U.S. realize its full economic potential regarding small-scale natural gas exports and associated technologies through greater regulatory certainty surrounding the export approval process. This amendment ensures that only applications for small amounts of natural gas exports that also qualify for a categorical exclusion under DOE's NEPA regulations may qualify for expedited treatment. It ensures that DOE must comply fully with NEPA regulations. H.R. 4606 will encourage the domestic industries involved in the emerging small-scale markets to take full advantage of the economic opportunities throughout our Western Hemisphere. It can help provide countries in the Caribbean and Central America with a stable source of energy, as many are reliant on Venezuelan fuel oil that has been used to gain influence in the region. It's important to note the benefits of increased U.S. energy engagement within this region has long been recognized as the former administration created the Caribbean Energy Security Initiative, while Secretary Perry is currently working through a proposed DOE rule to encourage small-scale exports. This bill helps further those bipartisan goals. Additionally, H.R. 4606 will help bring the Natural Gas Act into the 21st century to reflect this era of domestic energy abundance. I would like to thank Representative Green and his staff for working with me on this amendment, and I'm hopeful that more members across the aisle will recognize that hard work by supporting this bill. And before I yield the remainder of my time to Representative Green, I'd like to ask for unanimous consent to submit a letter of support for H.R. 4606 written by the Center for Liquefied Natural Gas.
Without objection, so ordered.
And with that, Mr. Chairman, I yield to Representative Green.
Mr. Chairman, I want to thank my colleague for yielding, but I think I'll just strike the last word so I can get 5 minutes, if that's okay.
That's fine, Mr. Chairman. I yield
You
back.
could have had 5 minutes and 6 seconds, but not anymore.
I yield
Gentleman
back.
yields back. Chair recognizes the gentleman for Texas.
Thank you, Mr. Chairman, and thank my good friend, Mr. Johnson, for yielding me 4 seconds. But this amendment's a good faith effort that we reached working across the aisle, as Congress should. I've always said that Congress should streamline the regulatory process where possible to encourage development, that we don't have to sacrifice bedrock environmental protections to do so. This amendment would codify existing environmental protections under the National Environmental Policy Act, and I encourage my colleagues to support it. These protections include both the potential direct and potential indirect environmental impacts of any decision that are currently considered at the DOE in consultation with other agencies. There is strong interest in U.S. natural gas all throughout Caribbean and Central America, where stable sources of energy are hard to find. The U.S. gas will help reduce emissions throughout the region and spur the development of the stable grids with varied fuel generation sources. This would include Puerto Rico, and we know the problems Puerto Rico has had because of and rebuilding their grid. Natural gas would be a good base load for them. I'd like to thank Mr. Johnson and his staff for their willingness to address his environmental concerns with this amendment. I did not support the bill at the subcommittee level, but I'm happy to vote in favor of it now with these improvements. This amendment represents a good faith effort to address the concerns that many of us had on this side of the aisle raised at the subcommittee level. It is another demonstration how a bill can be improved through regular order. I urge my colleagues to support the amendment and the bill itself, and yield back the balance of my time.
Gentleman yields back the balance of his time. Chair recognizes the gentleman from Michigan for 5 minutes. Strike the last word.
Well, thank you, Mr. Chairman. I just want to tell my colleagues not on the Energy Subcommittee that we had a long discussion about this. I made the point that we wanted to make sure that NEPA was not violated, as the gentleman from Texas indicated in his statement. Also, nothing in this bill will have any effect on FERC's authority to any requirement to obtain a permit for an export facility either. So we're where we should be. I think we strengthened the bill with this amendment. Many of us, a number of us, went down to the Caribbean after the terrible hurricanes that struck the U.S. and Puerto Rico and American Virgin Islands. We know that there's a real need for alternative energy there that's not relying on the old naphtha fuel or archaic grids that they have to provide for the millions of folks that live there. This is a bill that can make the difference throughout the entire Caribbean region. So I'd like to think that we can pass this bill with a good bipartisan vote, and this amendment strengthens that and makes sure that, in fact, we're not taking away from NEPA or FERC the normal authorities that they might have, and I yield back the balance of my time.
Gentleman yields back the balance of time. Chair now recognizes the gentleman from New Jersey, Mr. Pallone, for 5 minutes. Strike the last word.
Thank you, Mr. Chairman. I just wanted to commend Mr. Green and Mr. Johnson for working together on this amendment to fix the NEPA earmark in the underlying bill, and I believe this amendment improves the legislation and should be adopted. However, as I said in my opening statement, I can't support the underlying bill. I still don't understand why we should spend the committee's time on legislation that codifies a proposed rule that is in the process of being finalized. The Trump administration has taken every opportunity, using every relevant official and at least one irrelevant one, to promote U.S. natural gas abroad. LNG exports are clearly a priority for this administration, and I have seen no indication that DOE's small-scale LNG rule will be delayed or pushed aside. So why not wait for the final rule to go into effect? There are drawbacks to codifying a proposed rule with such a prescriptive volume requirement, which is the reason to question the wisdom of this bill. For example, should the circumstance arise where exporting 0.14 billion cubic feet per day of LNG is no longer in the public interest, then Congress would have to enact a new law to make any necessary changes. Furthermore, DOE isn't even sure that the 0.14 is the right volume limit for these projects. The proposal asks for public input on the appropriate volume limit for a small-scale application, so this number could change in DOE's final rule. So again, we should wait for the final rule to go into effect. What's the rush? This is not to say that the DOE small-scale LNG rule is without fault. I believe it's problematic. It's a carve-out for a subset of LNG applications. It declares that all small-scale exports are always in the public interest, removes long-standing consumer protections, prevents the public from having an opportunity to know about or provide input on export proposals, violates the public hearing requirement of the Natural Gas Act, and fails to justify any of these changes to the existing approval process. I understand my colleagues' interest in helping our friends and neighbors in the Caribbean, but nothing in this bill or the proposed rule requires small-scale shipments to go to these areas. In fact, Puerto Rico is the largest importer of LNG in the region, and the problems associated with getting them natural gas are due to Jones Act restrictions, not DOE approval of export applications. So the proposal also fails to prevent applicants from using this new process to evade the public interest determinations required for large-scale exports by segmenting a large volume gas export into a series of smaller proposals. And finally, it's unclear the small-scale rule is even necessary. To date, DOE has received 13 applications to export small volumes of LNG to destinations in the Caribbean as well as Central and South America. All but two have been approved, and one of those outstanding applications requires an environmental review under NEPA, so it doesn't qualify for the rule's expedited procedures. So again, I see no problem here. I certainly don't see a problem that requires action from Congress. I believe that an unrestricted LNG export policy could significantly impact domestic natural gas prices and adversely affect American consumers and manufacturers. Furthermore, unfettered exports could be even worse for climate change by incentivizing widespread fossil fuel extraction with virtually no environmental protections and adding more fossil fuels to the electricity mix. So in my opinion, H.R. 4606 does not represent sound or timely policy, and I intend to oppose it. Thank you, Mr. Chairman.
Gentleman yields back. Balance his time. Chair recognizes the gentleman from Texas for 5 minutes to speak on the amendment.
I rise in support of the amendment. I think some of what the ranking member just said has merit. I think you can honestly debate whether the volume limitation is the exact correct volumetric requirement. I will say this, the real effect of Mr. Johnson and Mr. Green's legislation, if it's enacted, passed, and becomes law, is that it will make it somewhat easier for Caribbean nations that have no existing free trade agreement with the United States to expedite the process of getting a small amount of LNG to their market. If you have an existing free trade agreement, under current law, it is automatically deemed in the national interest to export LNG. If you have an existing free trade agreement, unfortunately, not every Caribbean nation has an existing free trade agreement. So the real effect of Mr. Johnson and Mr. Green's legislation is that those Caribbean nations that don't have existing free trade agreements can get these limited amounts of natural gas liquids into their market without going through a lengthy permitting process, and I think that's commendable. So I'm very happy and supportive of what they're trying to do and hope the committee would pass it.
Thank you, gentlemen. Yields back balance of time. Any other members seeking recognition? Seeing none. The vote now occurs on the Johnson amendment. So all those in favor shall signify by saying aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the amendment is agreed to. Are there any other amendments or any members seeking recognition on the underlying bill? If not, the question now occurs on favorably reporting H.R. 4606 as amended to the floor. All those in favor shall signify by saying aye. Those opposed, no, and the clerk will call the roll. This is a recorded vote for those watching.
Mr. Barton. Mr. Barton votes aye. Mr. Upton. Mr. Upton votes aye. Mr. Shimkus. Mr. Shimkus votes aye. Mr. Burgess. Mr. Burgess votes aye. Mrs. Blackburn. Mr. Scalise. Mr. Latta. Mr. Latta votes aye. Mrs. McMorris-Rogers. Mrs. McMorris-Rogers votes aye. Mr. Harper. Mr. Harper votes aye. Mr. Lance. Mr. Lance votes aye. Mr. Guthrie. Mr. Guthrie votes aye. Mr. Olson. Mr. Olson votes aye. Mr. McKinley. Mr. McKinley votes aye. Mr. Kinzinger. Mr. Kinzinger votes aye. Mr. Griffith. Mr. Griffith votes aye. Mr. Bilirakis. Mr. Bilirakis votes aye. Mr. Johnson. Mr. Johnson votes aye. Mr. Long. Mr. Bouchon. Mr. Bouchon votes aye. Mr. Flores. Mr. Flores votes aye. Mrs. Brooks. Mrs. Brooks votes aye. Mr. Mullen. Mr. Mullen votes aye. Mr. Hudson. Mr. Hudson votes aye. Mr. Collins. Mr. Kramer. Mr. Kramer votes aye. Mr. Wahlberg. Mr. Wahlberg votes aye. Mrs. Walters. Mrs. Walters votes aye. Mr. Costello. Mr. Costello votes aye. Mr. Carter. Mr. Carter votes aye. Mr. Duncan. Mr. Duncan votes aye. Mr. Pallone. Mr. Pallone votes no. Mr. Rush. Ms. Eshue. Ms. Eshue votes no. Mr. Engel. Mr. Green. Yes. Mr. Green votes aye. Ms. Degat. Ms. Degat votes no. Mr. Doyle. Mr. Doyle votes aye. Ms. Schakowsky. Mr. Butterfield. Mr. Butterfield votes aye. Ms. Matsui. Ms. Matsui votes no. Ms. Castor. Ms. Castor votes no. Mr. Sarbanes. Mr. Sarbanes votes no. Mr. McNerney. Mr. McNerney votes aye. Mr. Welch. Mr. Welch votes no. Mr. Lujan.
Aye.
Mr. Lujan votes aye. Mr. Tonko.
No.
Mr. Tonko votes no. Ms. Clark.
No.
Ms. Clark votes no. Mr. Loebsack. Mr. Loebsack votes no. Mr. Schrader. Mr. Schrader votes aye. Mr. Kennedy. Mr. Kennedy votes no. Mr. Cardenas. Mr. Ruiz. Mr. Ruiz votes no. Mr. Peters. Mr. Peters votes no. Ms. Dingle. Ms. Dingle votes no. Chairman Walden. Chairman Walden votes aye. Mr. Long. Mr. Long votes aye.
Mr. Rush?
Mr. Rush votes no.
I believe Mr. Scalise is on his way. Mr. Hudson? You're not. Oh, you are.
Mr. Hudson is recorded as aye.
The Whip of the House, Mr. Scalise, delighted to have you here. Would you like to be recorded on this bill as a yes? That's a great vote.
Mr. Scalise votes aye.
Mr. Scalise votes aye. I think that. Any other members wishing to be recorded? If not, the clerk will report the tally.
Mr. Chairman, on that vote, there were 35 ayes and 15 nays.
The ayes have it, and the bill is favorably reported as amended to the House floor. And the chair now calls up H.R. 5174. This would be number 2 on your programs, and asks the clerk to report.
H.R. 5174, to amend the Department of Energy Organization Act with respect to functions assigned to assistant secretaries and for other purposes.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments to the bill? Are there any amendments to the bill? Does anyone wish to speak on the bill? If not, the question now occurs on favorably reporting H.R. 5174 to the House. All those in favor will say aye. Aye. Those opposed, nay. The ayes appear to have it. The ayes have it. And the bill is favorably reported. Chair now calls up H.R. 5175. This would be number 3 on your list, as forwarded by the Subcommittee on Energy on April 18, 2018, and asks the clerk to report.
H.R. 5175, to require the Secretary of Energy to carry out a program relating to physical security and cybersecurity for pipelines and liquefied natural gas facilities.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments? Chair recognizes for what purpose the gentleman from Michigan.
I have an amendment at the desk.
Clerk will report the amendment.
Amendment to H.R. 5175, offered by Mr. Upton.
Without objection, the reading of the amendment is dispensed with. The gentleman is now recognized for 5 minutes to speak on his amendment.
Thank you, Mr. Chairman. This amendment is pretty straightforward. It's an amendment that we worked out with the minority. It has the support of the pipeline owners and operators who understand the importance of strong physical and cybersecurity protections for our energy infrastructure. I would note that the American Gas Association, the Interstate Natural Gas Association of America, and the Association of Oil Pipelines have all submitted letters in support of this bill now. It's no small feat that all of these groups are in agreement. I would ask unanimous consent that the letters be included as part of the record.
Without objection.
I want to thank Mr. Lobzak for working with me. This amendment clarifies and enhances the authorities of the DOE. It is not intended to be a regulatory program. It instead is intended to strengthen DOE's role to be able to coordinate cyber response, collaborate, and build capacity within states in the energy sector. So, as I said all along, this bill is about conducting research, communicating threats, and coordinated incident response across the government. I would note that it passed by a voice vote in subcommittee. I would like to think we can do it the same in full committee. Appreciate the hard work of the staff as we reached out a number of roundtables over the last number of months to make sure that this bill moves forward in the proper direction. And with that, I yield back my time.
Gentleman yields back. Is there further discussion on the Upton amendment? Seeing no one seeking time, then the vote now arises on approving the Upton amendment. All those in favor shall signify by saying aye. Aye. Those opposed, no. The ayes have it. And the amendment's agreed to. Are there any other amendments? Are there other members seeking recognition? If not, the question now occurs on favorably reporting H.R. 5175 as amended to the House. All those in favor shall signify by saying aye. Aye. Those opposed, no. The ayes have it, and the bill is favorably reported as amended to the House. Chair now calls up H.R. 5239. This is number 4 on your agenda, as forwarded by the Subcommittee on Energy on April 18, 2018, and ask the clerk to report.
H.R. 5239, to require the Secretary of Energy to establish a voluntary CyberSense program to identify and promote cybersecure products intended for the use in the bulk power system and for other purposes.
Without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. Are there any bipartisan amendments? Are there any amendments? Chair recognizes the gentleman from Ohio, Mr. Latta, to strike the last word.
Thank you, Mr. Chairman. I just want to thank all the members for working on this piece of legislation and on the amendment in the nature of the substitute that we did in the subcommittee. Again, with the CyberSense, we want to make sure that we had the hearings with the Secretary of Energy and when FERC was here. That's very, very important to make sure that we have cybersecure for the bulk power system out there, and that people can be assured that the equipment can meet the needs, especially in this time of cyber attacks. And so with that, Mr. Chairman, I urge passage of the bill.
And yields back the balance of his time. Any other member seeking recognition? If not, the question now occurs on favorably reporting H.R. 5239 as amended to the House. All those in favor shall signify by saying aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it. And the bill is favorably reported to the House. Chair now calls up H.R. 5240. This would be number 5, and asks the clerk to report.
H.R. 5240, to provide for certain programs and developments in the Department of Energy concerning the cybersecurity and vulnerabilities of and physical threats to the electric grid and for other purposes.
And without objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. The chair recognizes the gentleman from Ohio. For what purpose?
Mr. Chairman, I have an amendment at the desk.
Clerk will report the amendment.
Amendment to H.R. 5240, offered by Mr. Latta.
Without objection, further reading of the amendment is dispensed with, and the gentleman from Ohio is recognized for 5 minutes to speak on his amendment.
Well, thank you very much, Mr. Chairman. And first, I would like to thank my friend and colleague, the gentleman from California, Mr. McNerney, for all of his hard work that we've done on the past bill and this bill. We want to make sure that we are enhancing grid security out there through this legislation. And this amendment to H.R. 5240, the Enhancing Grid Security Through Public-Private Partnerships Act, adds the term Electric Reliability Organization to Section 2 of the bill. The Electric Reliability Organization, ERO, is an organization certified by the Federal Energy Regulatory Commission and is responsible for establishing and enforcing reliability standards for the bulk power system. Currently, the North American Electric Reliability Corporation serves as the ERO. This amendment directs the Secretary of Energy to consult with the Electric Reliability Organization, in addition to state regulatory authorities, industry stakeholders, and other relevant federal agencies in carrying out its program to promote and advance physical security and cybersecurity of electric utilities. The valuable expertise of the Electric Reliability Organization has to offer will only improve the effectiveness of this DOE program. And Mr. Chairman, I would urge adoption of the amendment.
And gentleman yields back. Are there any members seeking recognition on the Latta amendment? Gentleman from California is recognized for 5 minutes. Strike the last word.
Strike the last word. Thank you, Mr. Chairman. I want to thank my friend, Mr. Latta, for working on this bill. I support the amendment, and I support the underlying bill. Basically, everyone here knows that there's a potential threat to our grid from cyber attacks. The results could be catastrophic, so we need to take steps to protect ourselves. This bill and the last one, 5239, do that. I urge all my colleagues to not only support this bill, but to think about how we can support securing our grids from cyber attacks in the future. I yield back.
You're here. Gentleman yields back, balance of his time. Other members seeking recognition on the Latta amendment. Seeing none. If there's no further discussion, those in favor will say aye. Those opposed, no. Those in favor say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it. The amendment is agreed to. Are there any other amendments on this, our final piece of legislation today? Not that I need you all to get too creative as we wrap things up. Anyone else seeking recognition? Okay, then I just want to thank the members. We'll vote on this, but for your participation, we passed 31 bills today, 30 of which went unanimously, I think, and the 31st was by overwhelming majority. So thanks for your good work. We will have a markup next week. We know some of the more complicated issues will be taken up then. The question now occurs on favorable reporting H.R. 5240 is amended to the House. Those in favor shall signify by saying aye. Aye. Those opposed, no. The ayes have it. The bill, as amended, is favorably reported to the House. For what purpose, gentlemen from New Jersey, seek recognition?
Mr. Chairman, House Rule 11, Clause 2L accords the committee minority 2 additional calendar days to file supplemental and dissenting views on legislation that is reported out and forwarded to the House. Pursuant to that rule and clause, I'm giving notice of our intent to file such views. And again, thank you, Mr. Chairman. I yield back.
More than welcome. And I'd like to submit statements from the following for the record: the Advanced Medical Technology Association and the American Society of Addiction Medicine, and a statement from Congressman Burgess. Without objection, the Committee on Energy and, without objection, staff is authorized to make technical and conforming changes to the legislation considered by the committee today. So ordered. Without objection, the committee now stands adjourned. Good work, everyone.